Calendar for the day. The first bill on the calendar for the day is Senate File 4410. The clerk will report the bill.
Senate File number 4410, number 1 on the calendar for the day, an act relating to Health and Human Services, the unofficial engrossment.
There are amendments at the desk, but if there's no objection, we'll let the authors explain the bill before we act on amendments. The member from Olmsted, Representative Liebling.
Thank you, Madam Speaker. Thank you for letting us describe the bill a little bit before we begin to consider amendments to this bill. There is a lot to discuss in this bill, and I would just like to start by saying that this year alone, the Health, Finance, and Policy Committee, which is just my portion of the bill, heard 126 bills, including 96 from members of the legislature. And most of that work and all of those hearings were done remotely. So for every bill that was introduced and for every bill that got a hearing, there were hardworking folks making it happen, and it was a lot of work. So I need to start by thanking some of the amazing people, some of the smart, creative, dedicated, and hardworking people who made that all happen and got us to where we are today. So first of all, our House research staff, nonpartisan House research, and I know every member of the House really appreciates their work. Elizabeth Clarkvist, Randy Chun, Danielle Punelli, Sarah Sunderman, and Annie Mock, they are just our stars. The revisor staff, who work so hard, and most of us don't ever meet them, but they do so much for us. Alex Willie, Dean Trefts, and Sandy Glass-Serrani. Our House fiscal staff, Doug Berg and Joe Harney, again, amazing folks. Our partisan researchers who worked so hard for us on both sides of the aisle, Joe Durheim for the DFL and Jeremiah Wingstead for the Republicans. Thank you for your hard work. I also really do want to appreciate here, acknowledge the commissioners who work so closely with us, Commissioner Jan Malcolm of the Department of Health, and Commissioner Jody Harpstead, the Department of Human Services. And I want to thank Governor Walz for appointing them and for listening to them. They do amazing work for Minnesotans. You don't know how lucky you are until you've worked with these people. And they have amazing staffs working with them and for all of us, especially Lisa Timian, who works for the Department of Health, and Matt Burdick, who works for the Department of Human Services. And I don't know how these people do it. They are just amazing. And their fiscal teams, Elise Bailey and Shar Kimber, and all of the people behind the scenes who most of us don't meet, but just work their tails off every day to make this enterprise work and to serve Minnesotans. And finally, before for the thank yous, of course, I cannot forget my committee administrator for the Health Committee, Patrick McQuillan, who does the work of 2 or 3 people, I must say, and my hardworking and extremely knowledgeable legislative assistant and committee legislative assistant, Krista Niedernhofer. And finally, I want to acknowledge my co-chairs and colleagues, Jennifer Schultz, who's going to be speaking as well, and who is serving her last term here. And I just can't say enough about Jen and her work and smarts and dedication. And Mike Freiberg, who chaired the Preventative Health Division, that was, the bills went through to come to health, and all of the members in both parties on all of our committees and divisions. You are appreciated so very, very much. So now I'm going to talk about the bill. Even the thank yous are long on this bill, but just to try to briefly explain a little bit about what this bill does. This is a bill that puts Minnesota on a path to success by making healthcare more affordable and accessible for Minnesotans. We know that many providers, healthcare providers in Minnesota, do a fantastic job. They work so hard to keep Minnesotans healthy and help all of us when we're in need. We ask them to perform miracles, and often they do. But too many Minnesotans still can't access healthcare, even if they're insured, because of the cost. or they can't get an appointment when or where they need it. It almost goes without saying that the pandemic has revealed how tied together we all are. We matter to each other, not only because our religious traditions tell us so. We have really seen, literally seen, how one person's illness can impact everyone. One person's illness can even start a worldwide pandemic. So it is very important that we pull together and make sure that everyone gets the care they need when they need it. This bill puts Minnesota on a path to success by improving access to insurance at lower cost, and it works to remove barriers to care, not just to insurance, but to health care. It works to find better and less expensive and more equitable ways of delivering health care to Minnesotans and keeping them healthy. It invests in public health and has resources in it to help us all be as healthy as possible. And it works to make sure that every child in Minnesota gets off to a healthy start. It takes real steps to control drug prices so Minnesotans who get a prescription can actually get the medicine they need to be healthy, or sometimes even just to stay alive. And doing that work, I want to say, is not easy at all because the drug lobbyists work hard to stop these bills. But the crisis for Minnesotans is just too large to let them stop these bills. Democrats in this legislature are standing up to the lobbyists and forging ahead. This bill works to sustain the healthcare workforce we have now and build it for the future, because Minnesota's needs are growing and we must make sure that we are prepared for that. And that means making sure people from diverse backgrounds and communities have the opportunity to achieve their dream of becoming a healthcare provider, because we need them now more than ever. So there is so much more I could say about this bill. I'm sure we're going to have a lot of discussion. You're going to hear now from Chair Schultz describing a little bit more about her part of the bill and some of the other chairs. And thank you so much for the privilege of allowing me to chair the Health Committee and for all of your hard work this session. Thank you, Madam Speaker.
The member from St. Louis, Representative Schultz.
Thank you, Madam Speaker. I also want to add my thanks. Thank you to Yingya Vang, my committee administrator. Thank you to my CLA, my legislative assistant, Lindsay Hansen, who really stepped up to do multiple committees, as well as being a legislative assistant to 2 members. Thanks to Patrick McQuillan, who helps on Team HHS. He's the hardest working CA I've ever worked with. And Chris McCall, who also helps towards the end of session. I also want to call out the DHS and MDH agency staff, who really do help us facilitate passing good policies in our state for the people of Minnesota. And this includes Christy Grom, who I work closely with in my committee. I want to thank the chairs of the divisions, Chair Peter Fisher, who worked in behavioral health, and Chair Aisha Gomez, who worked in preventing homelessness, and they'll both be speaking later today. I also want to thank Chair Liebling, who I've worked closely with for the last 8 years, and I really appreciate her extensive knowledge of healthcare, her devotion to the people of Minnesota, and I will miss working closely with her as I do not seek re-election. Members, this is another Health and Human Services bill that makes historic investments in human services. Services that help people every day. Older adults who prefer to stay in their homes rather than enter a nursing facility. People with disabilities who wish to live independently with services that they rely on. And caring professionals who devote their lives providing services to those who rely on them to survive. We are investing resources into addressing the healthcare workforce shortage, increasing wages for personal care assistants, funding for training to increase our healthcare workforce pipeline. The healthcare workforce shortage was a priority for our committee this session, and also creating a workforce incentive fund to fund employee retention in our caring professions. Members, when we invest in people, we all do better. When we invest in one another, when we care for our community, our family, our friends, our neighbors, we all do better. This HHS bill makes these investments. It invests in the people across our state. So I hope that you will support it.
The member from Ramsey, Representative Fisher.
Thank you, Madam Speaker. I rise to support this bill, and first of all, I'd like to thank the people who really helped out. First of all, our committee administrator, Lindsay Hansen, our legislative assistant, Spencer Kroos, Dave Sullivan and Harry Kennedy, who are DFL and Republican researchers, and Sarah Sutterman, who is from House Research. I also like to thank the members for their engagement, especially Vice Chair Frederick and Lead Frankie. The committee did a lot of great work this year. The Behavioral Health Division did a lot of great work this year with every bill passing out with unanimous support. We heard often that there was a lot of crisis in the substance use disorder world and in the mental health world, that we're having more and more people needing services, and there's a greater need as people are dealing with challenges in their lives. We need to make more services available. We heard in committee from many people. One of them was Hope Grothwald, who came before us and explained to us how critical programs helped her. She told her story about how she was dealing with mental health disorders, and that the services that were provided to her very early on helped save her life, helped keep her from becoming homeless, and allowed her to continue her education and to prepare her for her future career. One of the things this bill does is provide dollars and funding to increase the services out there to make sure that people like Hope will continue to be successful and productive in our society. Another area that we heard a lot about was the workforce shortage. Our Minnesota communities are facing an urgent need for dedicated, compassionate individuals to provide care for people with substance use disorder and mental health issues. This bill supports these SUD and mental health workers by providing funding for wages, grants, scholarships, and technical assistance to expand our compassionate workforce. And with that, I will move on. You can move on to the next speaker.
The member from Hennepin, Representative Gomez.
Thank you, Madam Speaker. I too have to start with thank yous, of course, to Vice Chair Heather Keeler and GOP lead New Brindley and all of the members on both sides of the aisle for all of the thoughtfulness and care that they brought to this work. To our really sharp and talented nonpartisan and partisan staff, to House researcher Justin Cope, our fiscal analyst Joe Harney, DFL researcher Molly Peterson, GOP researcher Chelsea Axelson, our committee administrator, Sean Herring, and to our CLA, Robin Schmidt. Thank you so much. You have our gratitude. So every year, 50,000 Minnesotans experience homelessness. And on any given evening, there are 20,000 people in our state, in every region of our state, who don't have a place to lay their head. The investments in preventing homelessness in the human services portion of the bill are the centerpiece of our response to this pressing issue. But you'll see all across our supplemental budget bill, and we've already heard some of these things, in the housing portion, in veterans, in capital investment, in health. We are acknowledging the severity and depth of this crisis and being real about what it will take to meet this moment in a way that serves those in our communities who need it the most. The comprehensive approach across our budget says something very clear and simple to our communities. In a state with a $9.5 billion surplus, no one should be sleeping outside. And we will not stand by as people in our communities, our people, fall through the cracks. A society with a growing homeless population, where, as in Minnesota, the fastest growing demographic entering homelessness are seniors, are elders, is a society whose systems are not meeting the needs of its people. Systems that have been cobbled together in response to crisis, not because they were necessarily the best approach, and systems that have never been adequately funded. The deep racial disparities that plague our state are borne out here too. When you control for income, Black Minnesotans are 13 times more likely and Native Minnesotans 22 times more likely to experience homelessness. The investments in this bill constitute a transformative step. The bill responds directly to the needs that we've heard over the last few months and in the last 2 years in our committee. And I can only assume for years and decades before this committee came together, from service providers, from advocates, local government partners, and most critically from unhoused people and formerly unhoused people themselves. We have amazing partners in this work, folks across the state in each of our communities who are hustling to make positive changes happen on a shoestring for some of the most vulnerable among us. With this bill, we're telling those providers who've moved mountains during COVID to keep their staff and their clients safe that they're not alone, that we have their back, that we've heard their needs and recognized that this moment of surplus, moment of plenty, is the time to support their work by building more than 1,500 shelter spaces in every region of our state and committing long-term to supporting the operations, case management, and support services that they need to do their work. We're telling our lowest income seniors and veterans that we don't think they should have their Social Security or VA benefits taken when they have to access shelter. We're telling our largest counties who have stepped up in these times that we're there for them, that we're not going to let the people they're serving fall off a cliff. And we're telling young people in our communities, those 16 to 24 who are not living with loving adults, that they're not alone. We're telling these young people, many of whom have been failed by the grown-ups in their lives, more than half of whom we heard in our committee have been in foster care, that we know they need specialized services to meet their needs so that they can become self-actualized members of our communities. We're telling them that they're worth investing in, and that we know it's not only the right thing to do from the perspective of fiscal responsibility, that we either pay now or we pay later in 100 ways, but that it's the right thing to do as human beings in community with one another. And we're telling our kids who have experienced homelessness and have been sexually exploited and trafficked, kids as young as 10. They had to change the parameters of this program to serve children who are 10 years old who have been sexually exploited and experienced homelessness. We're telling them that we're going to protect them and that they matter and that nothing they've done and nothing that has been done to them has ever touched or diminished the truth about their goodness and their intrinsic value. We're telling them that we're going to support them on their journeys of recovery and that we will fight for them. And I'm thankful that my committee passed that particular measure unanimously. Thank you to the committee members. So we have a chance today to change that story of underinvestment in those that need it the most. We have a chance to prevent more people from falling through the cracks. And I hope that we can earn your support. Thank you, Madam Speaker.
Thank you, Representative Gomez. The member from Hennepin, Representative Freiberg.
Thank you, Madam Speaker. I'm really proud of what we've accomplished putting this bill together, and I'm proud that it contains many provisions we heard in the Preventive Health Policy Division. So like other members, I couldn't do it without the great staff, both partisan and nonpartisan, that helps make us all look good. I'm terrified of listing all of their names, however, for fear that I will forget somebody. So I will move on to the bill. This bill will offer solutions for a healthier Minnesota. The bill will help us develop guidance for diagnosis, treatment, and care coordination for long COVID. It will help us rebuild state and local public health infrastructure and provide support for tribal care providers. Finally, it will help eliminate lead in schools, child care centers, and homes. We heard testimony about the dangers of lead in the Preventive Health Policy Division and heard consistently that there is no safe level of exposure to lead. The bill includes Representative Acom's proposal to fund testing and remediation for lead in drinking water, which we heard in the division. It also includes other provisions to address the hazards of lead, including Representative Jordan's proposal to modify the definition of elevated blood level, her proposal to create a grant program for lead service line replacement, Representative Howard's proposal for lead reporting in schools, and the governor's request that will enable cities to conduct an inventory of lead service lines. All of these provisions will have a clear public health benefit because of how harmful lead exposure can be, particularly for children. The HHS bill includes other proposals that we heard in the Preventive Health Policy Division, including Representative Bolden's proposal to fund a distribution program for COVID-19 tests and masks, Representative Hassan's proposal to increase public awareness of the risks of skin lightening creams, Representative Morrison's proposal to require coverage of commercial tobacco cessation treatment, and Representative Sandel's proposal to establish school-based health centers. These proposals all speak to the bill's focus on public health and prevention, which is particularly important as we are still experiencing the effects of COVID-19. I will be glad to support this bill and encourage other members to do the same.
The member from Ramsey, Representative Pinto.
Thank you, Madam Speaker. Members, Health and Human Services is a really critical and also complicated area. There are 6 committees that oversee it in our House, and so I'm the 6th and final committee chair to present the bill to you. I, too, want to thank my committee administrator, Sydney Spreck, and committee legislative assistant, Hans Dosland, and our amazing partisan staff, Mars Beltrandi-Rudquist for the majority, Jody Withers for the minority, who have to work in both this area and in the education area. And a shout out to my lead, Representative Franson, for her partnership in this work. Members, our committee has focused especially on child care and early learning, as you're aware. This is a sector that was in deep crisis well before the pandemic. The families in our districts have had this be unaffordable and inaccessible for them, paying as much as 40% of their income for the care that they need to go out to get the money they need to pay the rent and pay the food and to pay for the child care that they're getting to do all those things. Members, this is a sector that has paid its workers poverty wages. About a third of them are on public assistance themselves. A quarter experience food insecurity. Members, the bill before you addresses these needs. We increase rates for the Child Care Assistance Program to meet the federal standard for equal access for families, up to the 75th percentile. And we expand the program's accessibility for foster parents, for guardians, and others who especially need that support. And then, members, we also continue the monthly stabilization grants that have been going on since the beginning of the pandemic. You may not be aware we were the very first state to start providing support for the sector. That is why you have not heard about a collapse of childcare in your communities, is because those payments have been going out. We will continue those payments to make sure that we have public support for this public need. Members, there is nothing more important than getting our kids off to a great start. I am thrilled to have these provisions from our committee be linked with the provisions throughout this incredible bill to support kids in getting off that great start. As Representative Freiberg referenced, getting lead out of our communities so that kids' brains are not being impacted by that. It's incredibly toxic, even a small amount. There's proposals for voluntary home visiting to make sure that families have a check-in if they choose when the baby's born, to make sure that they have the support that they need. There is so much more. Members, I'm proud to have had the work of our committee be joined to those of the other committees you've just heard about, and are really eager to have a discussion today and earn your support at the end of this debate. Madam Speaker, thank you, and thanks to all.
There's an amendment at the desk. The clerk will report the amendment.
Liebling moves to amend Senate File Number 4410, the unofficial engrossment. The amendment is coded A15-1.
Member from Olmsted, Representative Liebling, to your amendment.
Thank you, Madam Speaker. And members, the A15-1 is the author's amendment that we always find one on a big bill like this. There are always things that are caught late and tweaks that need to be made. This doesn't make any real substantive changes to the bill. There are some fiscal changes here that are the result of some late understanding of the impact of the reinsurance bill on the Healthcare Access Fund. So this is correcting all of this so that the bill meets its target. And that's pretty much it for the amendment. I would appreciate your support.
Any discussion to the Liebling author's amendment? Seeing none, all those in favor, please say aye.
Aye.
Those opposed, please say no. The motion prevails. The amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Damath moves to amend Senate File number 4410, the unofficial engrossment as amended. The amendment is coded A22.
The member from Stearns, Representative Damath.
Thank you, Madam Speaker. Members, the A22 has to do with the hospital nurse staffing committees. What this amendment does is it deletes the provision in the bill that requires hospitals to have nurse staffing committees, which will create mandatory staffing ratios. It keeps MDH's nursing workforce report. It keeps money for the nurse loan forgiveness, and it keeps money for the mental health grants for healthcare workers. So you might wonder why we need to do this. We know that inpatient hospital care is delivered in a care team model. Of course, registered nurses are important, but so is the work of our licensed practical nurses, our nursing assistants, physicians, our respiratory therapists, laboratory professionals, and pharmacists. Each of these healthcare professionals is critical in delivering the best care possible. Scheduling which staff, both the number and the category of healthcare professionals, that will produce the best patient outcomes. It's what the hospital leadership, primarily the chief medical officer and the chief nursing officer, are constantly evaluating. Physician and nurse leaders play an integral part and role in knowing how best to manage the care throughout the hospital, not just on one unit of the hospital. They're constantly balancing the needs of all patients, looking at the acuity of the patients, the experience and availability of the entire care system and team. The language in the bill requires hospitals to have nurse staffing committee with a 50-50 labor to management ratio. The language in the bill reads the maximum number of patients on each inpatient care unit for whom a direct care registered nurse can be assigned. Members, this is a nurse to patient staffing ratio. The language reads a hospital must implement the core staffing plans approved by the majority vote of the Hospital Nursing Staff Committee. This is a mandate on hospitals and restricts a hospital's ability to adjust staffing based on patient need and nurse experience. Staffing decisions would be taken away from the hospital management and moved to a committee process. The hospital is still responsible and holds liability for staffing decisions, not a committee. The bill language says that the staffing committee must meet at least quarterly. Nurse managers are talking with the nursing teams on a daily basis and changing staffing based on patient need and based on what other care team members are available. Violations of staffing plans would occur if a new patient needed to be admitted above the staffing plan, or if a nurse called in sick. Patients would inevitably back up in emergency departments if additional patients could not be admitted if it violated the core staffing plan. This language in the bill stifles innovative and needed flexibility to move staff around between hospital units based on the patient need and the experience level of nurses. The language moves staffing decisions away from nurse management to a committee, which may not have the expertise to look at all hospital operations or know the availability of the other care team members. So members, I would ask for your support on this amendment, and Madam Speaker, I would request a roll call.
Representative Damath requests a roll call. Seeing 15 hands, there will be a roll call. The member from St. Louis, Representative Olson.
Thank you, Madam Speaker. I rise to ask members to vote down the Damath amendment. I've been working on this legislation for a while. I represent a district that has a large percentage of healthcare workers, a lot of nurses. So even before the pandemic, I was hearing stories of nurses who were working very short-staffed. And so we have worked incredibly hard on the provisions that remain in the bill, made a lot of changes. We took the number, we listened a lot to make sure we had other people that were at the bedside help to make decisions. So we We changed the makeup of the staffing committees to reflect that, to have other bedside folks at the table. We took down pieces that we heard would be hard to implement around enforcement, made significant amount of changes to the legislation while still honoring the fact that this is the #1 thing that nurses are asking. We have more nurses, licensed nurses in the state of Minnesota now than we've had in the last 5 years, but we have a shortage because they're leaving the workforce. And so what they are asking for is what is in this bill, so I would respectfully ask members to vote down the Damath Amendment.
Any further discussion on the Damath Amendment? Seeing none, the clerk will take the roll on the amendment. Members, please vote.
Thank you.
Will the clerk please call the names of the members who've not yet voted?
Berg. Berg. Hamilton.
Hamilton, aye.
Hamilton, aye. Hausman.
Hausman, no.
Hausman, no. Lewick.
Lewick, aye.
Lewick, aye. Mariani.
Mariani, no.
Mariani, no. Moran.
No.
Moran, no. Pearson.
Pearson, aye.
Pearson, aye. Swazinski.
Swazinski, aye.
Swazinski, aye. Thompson. Thompson. Zhang Jie.
No.
Zhang Jie, no. Berg. Berg.
The clerk will close the roll. There being 63 ayes and 66 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Rasmussen moves to amend Senate File number 4410, the unofficial engrossment as amended. The amendment is coded A14.
The member from Otter Tail, Representative Rasmussen.
Thank you, Madam Speaker. Minnesotans are concerned about rising costs, especially when it comes to health care and health insurance. And this amendment today will give us an opportunity to reduce the cost of health care for individuals who buy through MNsure. The amendment would reduce the MNsure premium tax from 3.5% to 1.5%. This premium tax directly contributes to higher health insurance costs for Minnesotans all over the state. If MNsure needs additional funding, they should come to the legislature and ask for it, not take it through hardworking Minnesotans through this premium tax. And actually, Madam Speaker and members, if we look at other states, for example, states that use the federal exchange, they have a 2.75% premium tax. And for states with their own marketplace but use the federal technology, their residents actually pay even less. And when this premium tax was originally introduced, it was set at 1.5%. And actually in 2015, Chair Schultz had a bill to reduce it down to 1.5% as well. And so, Madam Speaker and members, I think this amendment is a common sense amendment, will reduce health care costs for Minnesotans, and I would ask for your support.
Member from Olmsted, Representative Liebling.
Thank you, Madam Speaker, and I'm going to urge members to vote no on this amendment. we've seen during the pandemic that the number of people using the MNsure exchange has risen. It's now about 134,000 people signing up for coverage through MNsure. And MNsure has played a critical role in helping Minnesotans maintain their coverage and driving down the number of uninsured people to the lowest level ever. So a cut like this would lead to unacceptable wait times for consumers, and it would be very, very disruptive at a time when Republican members have championed spending $800 million to help to give to the insurance companies to hopefully reduce the cost of health insurance a little bit. So this is a very penny wise, pound foolish kind of amendment. This will really hurt all of those consumers who are now able to compare policies and buy insurance that works best for them on the exchange, many of them using the insurance subsidies that have been actually really higher, and that's helped people get insurance. The Biden administration made sure that there was higher help available for folks to help them purchase insurance and stay insured during the pandemic. So I would ask members to vote no on the amendment.
Any further discussion on the Rasmussen amendment? The member from Isanti, Representative Dowd.
Thank you, Madam Speaker and members. Just a reminder that we have spent about $700 million on a website that allows people to choose a health insurance plan. Not to mention that they could choose that health insurance plan on the health insurance company's website. But we have felt, or you have felt, that the state needs to have a website for people to choose insurance on the individual marketplace, private insurance. So that website now has cost folks $700 million. And it is a broken promise by Democrats who said that this tax would never be that high. I think it was 15 minutes before the tax was absolutely at the max that you could get out of Minnesotans. Not to mention the fact that Democrats' biggest priority in the last session was putting back in place the sick tax or the provider tax. But at least Democrats have been consistent in my time here in the legislature that they have done everything they can to raise the cost of health care. So this is your opportunity to actually reel that back. Let's reduce the cost. By the way, there are other states that put this website in place. I think one I heard was $600,000. They built and operated their website for $600,000. In Minnesota, $700 million. You should be proud of yourselves. So you have made health care more expensive here than almost any other place on earth. Congratulations, Democrats.
Representative Rasmussen.
Thank you, Madam Speaker, and I would request a roll call.
Representative Rasmussen requests a roll call. Seeing 15 hands, there will be a roll call. Any further discussion to the Rasmussen amendment? Representative Rasmussen.
Thank you, Madam Speaker, and I would encourage all members to support this amendment. Going back to when MNsure was set up, the tax was only 1.5% on premiums before it went up to 3.5%. And I would hope that MNsure has had time to look for efficiencies and ways to provide the tasks that they do at a lower cost. And also want to remind members that we had a member from the majority party who back in 2015 had a bill to also drop the premiums down to 1.5%, which is what this amendment would do. Let's try to help reduce the cost of health care on Minnesotans, and this is a small step that we can take here today. Thank you, Madam Speaker.
The clerk will take the roll on the amendment. Members, please vote. Will the clerk please call the names of the members who have not yet voted?
Berg.
Berg, no.
Berg, no. Hamilton.
Hamilton, aye.
Hamilton, aye. Hausman.
Hausman, no.
Hausman, no. Mariani.
Mariani, no.
Mariani, no. Moran.
No.
Moran, no. Thompson. Thompson. Zhang Jie.
No.
Zhang Jie, no.
The clerk will close the roll. There being 62 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Backer moves to amend Senate File Number 4410, the unofficial engrossment as amended. The amendment is coded A17.
The member from Traverse, Representative Backer.
Madam Speaker, members, what this amendment does is it increases training dollars for volunteer EMTs and first responders. So for example, right now, when someone decides to sign up, like we are working very hard at my service to find EMTs because there's only 3 of us on call. Right now, the city of Browns Valley would only receive a reimbursement of $600. What this bill does is it takes that and increases it from $600 to $900. Roughly, it's about a $1,500 training expense, so the community, the ambulance services will fit the bill for the rest. Several of you have heard me on the floor. We do a fundraiser, my wife and I, every year. We raise between $22,000 to $35,000 to help the service keep in the black. It also, what it does, it would increase the EMT refreshers from $275 through $375. As an EMT, volunteer EMT, I have to take a refresher course, and all my colleagues every 2 years, which is a good idea, but it is a lot of time. So what we do as a body, we give the EMS Regulatory Board roughly $361,000. It has not been all used for training. So if we don't put this into the bill, then what happens is the excess money goes into the general fund. I think what we need to do, as several of you have heard me say on the House floor, we don't have a lot of volunteer EMTs signing up. So let's help the communities, because our rural communities are not flush with money when it comes to this service. It's a volunteer service. So if we don't pass this money, then it goes back into the general fund. It kind of does it in a unique way, but at the end of the day, if it's not used, what happens is we're not helping our EMTs in Minnesota. And everybody, when you dial 911, if you're up in Grant County or up at the International Falls, you want someone to respond and help you if you need an ambulance. So there is no new money in this amendment. My goal, of course, is to enhance volunteer EMTs right now, because that is the system that we use right now in Minnesota, is volunteer EMTs. Like Sunday night, just this past Sunday at 4 o'clock, we had a page that went out. Everybody who showed up are volunteers. And with us seeing a large decrease of EMTs in the community across the state, this is a small step. It's not going to solve the problem, but we need to do everything we can to make sure when our ambulances pull out of the rig. And also, Madam Speaker, I do ask for a roll call.
Representative Backer requests a roll call. Seeing 15 hands, there will be a roll call. Discussion to the Backer amendment. The member from Dakota, Representative Hewitt.
Thank you, Madam Speaker, and thank you, members. I'd be remiss if I did not recognize Representative Backer's unwilling work at trying to, for one thing, as he said, he was on a call at 4 o'clock on Sunday, but that's every day for him. And also, EMS owes him a big debt of gratitude, too, for his unwillingness to come to the state and work hard on rural EMS because we know it's in trouble. We know it's in trouble because of the current audit that happened this year. This bill, I'm going to ask you to vote it red tonight, this afternoon, because it doesn't work. As you heard Representative Backer say, his service only has 3 EMTs. This is not the recruiting bill we need. It's not working. The EMSRB, which is, all of us know, and we'll talk about this later, is having problems, and they're not getting their job done. That's why Representative Backer is going on calls every night. We need to change the way we're doing this. And I believe, in talking with the chair, that she will come out of conference with a much better bill. We're seeing great promise with EMTs in high school right now. This program puts money into something that isn't working. Chances are, if we roll this over again, it'll go back in the general fund anyways. It's time to stop doing the things we're doing and change it so we get our state back to where it is so all of us could live the way we want to live in Minnesota, water ski, snowmobile, and be safe if something happens to us. So, Representative Backer, I think you're great at doing this, but this is not the bill that's going to do it. I recommend a red vote. Thank you, members.
Any further discussion on the Backer amendment? The member from Pope, Representative Anderson.
Thank you, Madam Speaker and members. Well, I rise to support the amendment by Representative Backer. It seems like a common sense approach to an issue that we really feel out in greater Minnesota. Those folks that serve us out there are really heroes to us all. They give of their time and their time and talents and to serve us all. And this seems like a common sense, even though it isn't a large appropriation or whatever, but I rise to support Representative Backer and the work done by our EMTs all across the state of Minnesota.
The member from Wright, Representative McDonald. No, you were not seeking recognition. No, you don't need to, unless you wanted to. All right, any further discussion on the Backer amendment? Representative Backer.
Madam Speaker, members, I don't disagree that the system needs to be fixed. That's why I've introduced several bills this session, had some really good discussions with the chair, but we do have to get through the gap. Folks like me who are serving right now, we're not going to fix this right away. It's going to take several years. I've been in touch with several other states and what they do, and some are doing good things, some of them aren't doing good things. We can make an improvement, but we do need to bridge the gap. For folks like me who've been on a long time and our current volunteer EMTs, we still have to get training. You know, next year, I have to do a refresher class. Right now, we have 4 people who want to become an EMT in our community. We need 2 more. Those things still have to be done. So I don't disagree. This will not fix everything, but we need to bridge the gap till we make some really change. And I do appreciate Representative from Apple Valley and the work that we've done. This is not a partisan issue. It is a Minnesota issue. So thank you, Madam Speaker and members.
Seeing no further discussion, the clerk will take the roll on the amendment.
Yes, I'm going to get the sticky note up so that I don't forget. Yeah.
Will the clerk please call the names of the members who've not yet voted?
Berg.
Berg, no.
Berg, no. Hamilton.
Hamilton, aye.
Hamilton, aye. Hausman.
Hausman, no.
Hausman, no. Mariani.
Mariani, no.
Mariani, no. Moran.
No.
Moran, no. Thompson. Thompson. Zhang Jie.
No.
Zhang Jie, no.
No.
Thompson. Thompson.
Representative Thompson, if you're voting remotely, if you can say your name and then your vote so we can determine for sure if that's you.
Thompson.
Thompson, no.
Thompson, no.
Thank you. The clerk will close the roll. There being 62 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Quam moves to amend Senate File Number 4410, the unofficial engrossment as amended. The amendment is coded A9.
Member from Olmsted, Representative Quam.
Thank you, Madam Speaker and members. We've all seen over the years how healthcare costs grow, and they grow faster than many other things. They become a greater part of our budget. And we also see many wonderful, especially out of Minnesota entities, wonderful new drugs, medications, equipment to provide better health care. But most of these come with an increased cost. However, this amendment, pharmacogenomics, is a newer, cutting-edge, individualized medicine that actually cuts the cost. I added some things for you to see and review. One of them is a Kentucky Teachers Union study with their health care costs. The third page of that summary out of there left out an important thing. It's not just not giving the right medicine right away or the right dosage that is fixed with this. It also decreases the expected other medical costs. On the bottom of the third page, outpatient visits, they found 2% less than expected. For emergency department, a decrease in 7%. And for inpatient, the number of days for a stay was decreased 15%. That's a lot of money. And they discovered on the second page, you'll see the savings. So it's not just savings on medications, it's savings on the cost of other care because you get treatment, the right dosage sooner and avoid complications, avoid being the 1 in 10,000 that might have a severe reaction to a medication. You say, well, how is this, what kind of impact? Well, 80% of us have an inherent genetic variation, which when they do drug trials and they check for people that metabolize quick, slow, or have a reaction, it comes out. And this is about $300 now, but it lasts a lifetime because all the new medications that come out, when they have any variation amongst the trial, they look for these variants. And this genetic work is really big for mental health. Too often, you can spend a year and a half finding the right med, finding the right dosage, tuning it in. And in that time period, people are readmitted, and unfortunately, too many people don't survive until they find the right medication for them. So this isn't just about dollars, it's about helping people. And this bill needs more ways of saving, of cutting healthcare costs, and providing better coverage, better results for patients, for people, and if you talk healthcare disparities. Plavix, a lot of people have heard that, about that drug. It's very common with heart disease. The Pacific Islanders and part of the people from Asia have a variant that half of them do not metabolize. Plavix does not work for them. In fact, the state of Hawaii won a multi-$100,000 of, they had a lawsuit, and it was like $200,000 or $300,000 that they won from the drug companies because they kept advertising when a huge portion of their population can't use Plavix. It does nothing for them. That shows just one example. Now, Mayo and the U of M are big with this. They're cutting edge. And the idea is if we're going to roll this out, there are problems with education, pharmacists and doctors. We need to have the appropriate training. We need a portal, an IT system that will more readily share it across. Because we remember when Epic and the other portals came out amongst hospitals, they didn't always talk to each other. So the idea is, underneath the Board of Pharmacy, have a task force that brings the parties together, and we roll this out in Minnesota so that we have fewer issues with it. It's broader and more usable across the state because we don't know what may happen next week. Any one of us could have a condition that would require medication. And a lot of senior citizens have multiple medications. So this is a way of being smart and trying to have Minnesota ahead of the curve and drop that increased cost for medical care. Thank you.
Discussion to the Quam amendment.
Madam Speaker.
Member from Olmsted, Representative Liebling.
Thank you, Madam Speaker. Thank you, Representative Quam. We did hear this bill in last year, and it needed some work, and I know some work's been done on it recently, and I think I appreciate your explanation of the underlying issue, and I'm not arguing with anything that you say, but I don't think that the bill is ready to just be adopted as an amendment. For members, this creates a task force with, by my quick count of the bill, it's 23 people in the task force. I think it needs some more discussion, but I don't disagree with you about the underlying issue. I think this, I'm happy to work with you and work this forward, but I would ask members right now to vote no on adding this as an amendment on the bill. So thank you for your work on this, Representative Quam. I think you're onto something on the issue, and sometimes by being persistent like you are, people do hear enough times and they begin to understand where you're going with this. But I do think the bill needs more work, and so I'm going to ask members to vote no on the amendment.
Any further discussion on the Quam amendment? Seeing none, all those in favor, please say aye. Aye. Those opposed, please say no.
No.
The motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Keel moves to amend Senate File Number 4410, the unofficial engrossment as amended. The amendment is coded A30.
The member from Polk, Representative Keel.
Thank you, Madam Speaker. First of all, I would request a roll call.
Representative Keel requests a roll call. Seeing 15 hands, there will be a roll call. Representative Keel.
Thank you, Madam Speaker. The Amendment A30 updates the Minnesota nursing home payment system. If this passes, nursing homes could be paid at a cost of labor for chefs, cooks, diabetics, housekeepers, maintenance, laundry employees, and many other staff that are critical to operating nursing homes. I think a lot of times when we see a nursing home, we don't really think about all the other things that happen in a home, in a nursing home. It establishes the inflation factor in the nursing home payment system that will help the nursing homes cover their rising costs. Currently, there is a 27-month delay between when a nursing home reports their cost and when they are paid for those costs. This also provides an increase to nursing home rates of $52.11 per resident per day from July 1st, 2022 until December 31st of 2024, which they must use to increase compensation for their employees. Why do we need to do this? Many people would say nursing homes are expensive. What's going on? But we have to think back to all the things that need to happen in a nursing home. We want our nurses to be paid well. If we are going to pay our nurses well, it is going to cost money. But we also want people that provide food, janitorial services that range in all kinds of ways. So nursing facilities are struggling to keep their staff. The pandemic made their staffing struggles even worse. There were 23,000 open positions at nursing facilities across the state. That's 20% of their total workforce. This workforce crisis has forced homes to turn away potential residents. Occupancy rates are around 75% of their maximum. The low occupancy means that the homes are losing even more money. This is causing a spiral that, without action today, will cause more homes to close. I have one in my district that is hanging on, and I don't know. We need this to pass. We've heard this bill in session already, and I think we need to address it. Since 2019, 16 nursing homes have closed. 4 have closed just in the start of this year. Just in March, Ramsey County Nursing Home closed. It displaced 95 residents and 130 workers. The open positions are across all areas. Once again, housekeeping, dietary, direct care staff. Nursing homes cannot rely on one-time funding like is in the bill to provide permanent wage increases with nearly $10 billion surplus. We should prioritize funding for our struggling industries. The investments made in this amendment will allow homes to pay their staff competitive wages and help ensure that no more homes shut down. Members, I'd really like you to think about when you go to a nursing home and all the actions that have to happen in there. And I've had people call me and say, they won't take my mother. There's no room. But when I go visit, there's an empty bed. Well, guess what? There's no nurse to take care of them. And I know what it's like to take care of many, many patients. Our hospitals and our nursing homes really need aides to be able to help those RNs and LPNs take care of the personal needs that have to happen with residents and the time that it takes to take care of someone in the nursing home. And one other thing, I've noticed that in the changes, I was 18, so you can figure out it's been a while, when I was in the nursing home working as an aide, but the care is tremendously different. We don't have people in the nursing home like we used to. We have all kinds of different options for people to age, but now the nursing homes have very high, intense needs, and we've learned so much more about how to take care of somebody who's not mentally capable of taking care of themselves, but need that guidance and that loving care that comes from an aide. And our nurses that are helpful, I'm really concerned. We did, as nursing homes, provide some more security for our nursing homes, but that also cost them money, the requirements. And I firmly believe that if there were more staff, which we're trying to work on, that we wouldn't have some of the abusiveness that we did have, hopefully is corrected. Because when you have 2 people come in and take care of somebody that's having some challenges, it is much easier to handle that situation than if you just are alone and trying to help someone. And Many of you have heard all my little stories, so I won't go any farther, but I really would like us to consider, please vote yes on this A30 amendment.
The member from St. Louis, Representative Schultz.
Thank you, Madam Speaker. I urge members to vote no on this amendment. It strips out the language to fund the Minnesota Care buy-in, allowing individuals to purchase a program that we've had for over 30 years that was created with bipartisan support and has been successful at offering health insurance coverage at affordable premium, affordable cost sharing for Minnesota families. So members, this is a successful program. We want to expand that and allow people to buy into Minnesota Care. This is being deleted in the amendment, so members, I urge a no vote.
Any further discussion on the Keel amendment? The member from Isanti, Representative Johnson.
Madam Speaker, members, Representative Keel, thank you for this amendment. Over the past few months, I've been dealing with this issue with my family. No place to provide care that family members need. For those of you that have a parent or a relative that's looking for assisted living, because of lack of staff, it could be 6 to 18 months to find some place to put your loved one. I recently had a family member fall and had to go into recovery care. It took 5 days to find a bed for her. 50 miles from where she lives. This is a huge issue. And if we don't start doing the funding that's desperately needed in this area, we won't have any of them. We won't have any place to bring your mom or dad when the time comes that they need that specialized care. This is a serious situation that we need to deal with. Thank you, Representative Keel, for this amendment.
The member from Sibley, Representative Grunhagen.
Oh, thank you, Madam Speaker. Yeah, thank you, Representative Keel, for bringing this forward. You know, my mom was just in the nursing home, and my mother-in-law is also in assisted living. And it did take a while as far as the staffing is concerned. And I'd just like to remind the DFL that back in 2019, you proposed a $68 million cut to nursing homes. Now, and this funding is from cutting access to Minnesota Care, which is low reimbursement, which is going to hurt our hospitals and doctors. So this is a very good amendment. I would urge you to support it. And again, I'll simply repeat one statistic that Representative Keel repeated. So far, we've had 16 nursing homes in 2019 close, a lot of them in the rural areas. And this year, we've had 4 close already. So members, I'm a needs, want, and desire person. This is a need. The expansion of Minnesota Care is a want or a desire towards single payer, which is going to be a disaster for our healthcare system. I won't repeat the half-hour speech I gave earlier on the House floor. But members, think about these people in the nursing home that need your assistance. Many of them can't bathe themselves or toilet themselves or dress themselves. They desperately need help. And the people who help them, I consider many of them to be angels, okay? And again, I've just experienced it lately. And again, the waiting time, especially in the rural area, has gotten excessive. So members, please support Representative Keel's amendment. Vote green. Vote for your parents and grandparents who one day will probably need this, if not now. Thank you, Madam Speaker.
The member from Stearns, Representative Tice.
Thank you, Madam Speaker. This is something that I've been interested in for a long time, and I'm really glad to say that I was on the committee when we had aging and long-term care. It's a standalone committee. But now it's personal. In October, my mom fell, and she needed some care to get a little bit stronger, and so it took us quite a while, in about 6 nursing homes, before we could find one. We did get her in Watkins, which is my hometown, but she was there for only about 5 weeks. And after the start of the year, in February, Mom started having some more health issues. And it took us, again, a long time to find a nursing home that would accept my mom. It's really hard when you're looking at it and you're looking across, in central Minnesota, you're looking across the state to see where you can find a place. We were very fortunate to be able to have Mom stay at Edenbrook in St. Cloud. I will tell you folks that if you think that this isn't important enough, then you aren't visiting your nursing homes enough. Because there's all kinds of people there. There's young folks who, for whatever reason, are there. But what's most amazing are the staff that work there. And I will tell you, there's never enough staff. The turnaround is great. And I remember probably 5-6 years ago, visiting the nursing home in Waite Park and visiting a friend, and she said, "Will you please pay these people more so I don't have to keep training them on how to take care of me?" We haven't done anything since then. It has been so hard, and yet these folks have supported Minnesota all their lives, and we're saying, but we're not finding you important enough or your care important enough to do anything different. I was talking to Lizzie, who's one of the nurses there, and she said that it was such a blessing to have the guard come in and help them because they could finally recharge their batteries. They could finally recharge their batteries. And it's so sad to hear that. The staff is so incredible. They are so much fun. My mom enjoys being there. They are so nice to her. But it just makes me so angry that we talk about it, and when it comes to these omnibus bills and funding it, we don't do it. I remember visiting one of the homes in my area for folks that need care. And I remember talking to a young man who spends 70 hours a week at the house. Because by law, you can't leave if nobody's going to relieve you. And there's nobody else to take his place. And they can't find more people to work because we don't pay them enough. And I would say, guys, we're reaching the point where enough has got to happen, or we're going to be closing more. And then what do? Where do they go? And we're going to say, I don't know. We didn't think it was more important now. This makes me angry. And at some point, you're going to find yourself in a situation like a lot of us are. Where do I put my mom? Where do I put my dad? And it could be from an accident, too, that they have to go into a nursing home facility for rehab. It's really getting desperate. It's really getting desperate. And I think it's about time we bite the bullet and do it. And not say, oh, but this is more important than long-term care. Well, it's not. It's not to many people. It's not to anybody. We need to start funding this. It's just, that's the way it is. Because this is personal to many, many people. And we have to start putting money for what we value. Thank you.
Further discussion on the Keel Amendment. Representative Schultz.
Thank you, Madam Speaker. I think I'm hearing the other side, Republicans, say that people who are uninsured don't need care as much as people who are in nursing facilities. People who are uninsured need health care too. You are eliminating the option for them to get affordable health care. Everyone deserves to have access to health care, everyone in our state. I hope we all agree on that. You are eliminating the ability for people to get affordable health care in our state. You're taking it out of the bill. That's what you're doing with this amendment. This is a program that was created with Republicans, with DFLers, to provide access to affordable care. 4% of our population is without access to affordable health care. 4%, a very high percent, underinsured because they have high out-of-pocket costs, high deductibles, high cost sharing. You're taking an affordable option out. Members, please vote no.
Representative Keel.
Thank you, Madam Speaker. Representative Chair Schultz, you referred to the program we have now as being affordable and successful. If that were the case, we wouldn't see the nursing homes closing. We wouldn't see the problems we're having. I hear things about money makers, and there are some very nice nursing homes, but most of our rural nursing homes are struggling just to keep their doors open and provide care. Your reference to providing insurance in coverage for people, I don't know, but in my world, whether you are conceived or at 130, you should have care. We should take care of people. Why would we say that one person was more important than another? We shouldn't treat disabled that way. We shouldn't treat healthy people that way. And the reality is that, guys, I don't plan to go to the nursing home. I don't really want to go to the nursing home, and most people don't. And one day, a stroke, a car accident, who knows? And I'm laying in the nursing home going, this wasn't what my plan was. And many people don't plan, and that's unfortunate. But this is a costly care, just like all of our disabilities. It is costly to them. But the fact is that we mandate, we regulate, we take care of nursing homes in a way that makes it difficult for them to run. And yes, we have some real challenging issues with nursing homes, but they are trying their best to provide the health they can. And this nursing homes have evolved so much in 30, 40 years. We used to have everybody, they shared, rarely did they have their own room. They went there if they couldn't take care of themselves one way or the other. Now we have assisted living, we have memory care, we have all kinds of options. They have different levels of need, they have different levels of cost. But in this amendment, it is important to understand that we are on fire. There is a serious problem with nursing homes. We're not talking about, oh, well, we'll look at it later. We'll get it done next year. We'll fix it. We have got a serious problem. And each and every one of us, the day the doctor comes to us and says, well, Mrs. Keel, you can't go home. I don't know what you want to do, but you aren't going there. And my children, and I've already experienced it because my husband got sick, my children are really good at stepping up and making decisions. But what do they do if they are not capable of taking care of me, or my house isn't capable of handling it? And many of our seniors are in that boat. They can't live in their own homes. They don't have the ability to care for themselves in their homes. And I know we do things that are home and community-based, which is wonderful. But this really needs to be a green vote. And I ask members to please support Amendment 30. Thank you.
Seeing no further discussion, the clerk will take the roll on the amendment.
Thank you.
Will the clerk please call the names of the members who have not yet voted?
Berg.
Berg, no.
Berg, no. Eklund. Eklund, no. Hamilton.
Hamilton, aye.
Hamilton, aye. Houseman.
Houseman, no.
Houseman, no. Lissagard. Lissagard, no. Moran.
No.
Moran, no. Pearson. Pearson. Thompson. Thompson.
No.
Thompson, no. Pearson.
Pearson, aye.
Pearson, aye.
The clerk will close the roll. There being 62 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Franzen moves to amend Senate File Number 4410, the unofficial engrossment as amended. The amendment is coded A12.
The member from Douglas, Representative Franzen.
Thank you, members, and to the public that is watching. So the amendment before you is going to study adverse reactions to the COVID vaccines, as well as require MDH to monitor trends, health outcomes, and quality of life for patients who experience adverse reactions to COVID vaccines. It would also create a $5 million fund to compensate patients who faced serious adverse reactions to the COVID-19 vaccine. President Biden recently quoted, "Imagine had the tobacco industry been immune to being sued." Well, that's the sweet deal that pharma has with vaccines. We can go back and do the history of the 1986 Vaccine Injury Act. Through the 70s and 80s, there was a number of lawsuits brought forward due to the DPT lawsuits against vaccine manufacturers. And those lawsuits were increasing dramatically, and the manufacturers were saying, we're just not going to do this anymore because it's way too costly. So fast forward in 1986, the Vaccine Injury Compensation Act was passed, and pharma was given a pretty sweet deal. Those on the vaccine schedule would be held harmless from lawsuits, and families could petition the government for financial assistance, and if they qualified, there would be a payout. It's very difficult to get a payout because most people, when they say they have an adverse reaction, or parents say that their child had an adverse reaction, they are not believed. In 2010, the Countermeasures Injury Compensation Program, or CICP, was created. It was created to provide compensation from injuries or death as a result of government-mandated or recommended vaccines, drugs, or medical devices as declared by the Secretary of Health and Human Services to address a public health emergency. Today, we are going to focus on the COVID-19 vaccine. We are not going to focus on the vaccines on the childhood schedule. Today, this discussion is simply COVID-19 vaccines. So remember the days when cigarettes, although not FDA approved, it is regulated by the FDA, but cigarettes were considered safe. Doctors said cigarettes are safe. People smoked. You'd have smoking rooms in hospitals. And then one day, they weren't safe anymore, were they? There were lawsuits, and Minnesota was privy to a $6.5 billion payout. Or imagine this, what if opioids were a liability-free product, right? Remember the Sackler family at Purdue? Sacklers lied People died. Imagine if Congress had given immunity to the manufacturers of opioids. And what if that same product was mandated? Could you imagine? You know what other pharma projects or products were considered safe but ended up not being quite so safe? Because the government, through lawsuits, found out that pharma had lied. DDT, Agent Orange, talcum powder, mercury, asbestos, phthalimide, Vioxx, also opioids. The pharma industry has a history of fraud, bribery, lawsuits, scandals. This is not a conspiracy, it's the truth. They continue, the big pharma business continues to do business. So this amendment I am bringing forward is because adverse reactions are real. Vaccine injuries are real. Recently, there was a press conference with those individuals, some individuals who had adverse reactions to the COVID-19 vaccine. Some of those same individuals met with Governor Walz's staff to discuss their reactions to the COVID-19 vaccine. These individuals that showed up at the press conference did what they thought they were doing for the better of society, to keep themselves safe and for others safe. Now they are not believed. This one individual, Susanna Newell, described at the press conference how her health changed dramatically within 30 hours of taking the COVID-19 vaccine. She was a once active triathlete who had no underlying health conditions. Her story was raw, it was real, and it was heartbreaking. She is one of many individuals in our communities, in this state, around the country, and around the world who have suffered as Pfizer profits. Their first quarter sales this year hit $26 billion. Those who suffer the adverse reactions assume all the liability. Big Pharma assumes all the risk. Judicial Watch took Pfizer to court and said, hey, we want to see the documents. Pfizer said to the courts, it's going to take 75 years, and we will release them. 75 years. Well, Pfizer did not get their way, and now there are data dumps. So this one data dump is and this comes straight from the courts. It's about Pfizer. The cumulative analysis of post-authorization adverse event reports received through February 28th, 2021. And on page 6, due to the large numbers of spontaneous adverse event reports received for the product, blah, 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 Pfizer has taken multiple actions to help alleviate the large increase of adverse event reports. This includes significant technology enhancements and process and workflow solutions, as well as increasing the number of data entry and case processing colleagues. To date, Pfizer has onboarded approximately 600 additional full-time employees. More are joining each month, with an expected total of more than 1,800 additional resources by the end of June 2021. One of the big things that we are hearing about with the young kids is myocarditis. When that age group, when the 12 to 18-year-olds, when it was authorized, these reports were coming out. And those that were speaking about the concerns of myocarditis were told that they are conspiracy theorists, and Twitter would ban them from their social platform. Now it's being studied. April 20th, which wasn't that long ago, 2022, there was a study done. SARS-CoV-2 vaccination of myocarditis in a Nordic cohort study of 23 million residents. The findings in a cohort study of 23.1 million residents across 4 Nordic countries, risk of myocarditis after the first and second doses of SARS-CoV-2 mRNA vaccines was highest in young males aged 16 to 24 years after the second dose. For young males receiving 2 doses of the same vaccine, data were compatible with between 4 and 7 excess events in 28 days per 100,000 vaccines after a second dose BNT 162b2 and between 9 and 28 per 100,000 vaccinees after second dose mRNA 1273. The meaning, it says in this study, the risk of myocarditis in this large cohort study was highest in young males after the second SARS-CoV-2 vaccine dose. And this risk should be balanced against the benefits of protecting against severe COVID-19 disease. So members, I plead with you and I beg you to believe these people, because vaccine injury is real and they need a voice at the table. No matter where you stand on vaccines, this is not an issue of pro-vaccine, it's not an issue of anti-vaccine. This is a discussion of a liability-free product that an individual has taken, and now they suffer from it with no recourse. So I ask you to please, please support the amendment.
Member from Hennepin, Representative Freiberg.
Thank you, Madam Speaker. I encourage members to vote against this amendment for a few reasons. First, it takes money away from a really important program, Representative Bolden's proposal to fund COVID-19 tests, masks, and respirators. We've seen COVID-19 cases steadily increasing over the last few weeks, increasing the need for tests and masks. Representative Bolden showed a lot of foresight advocating for this program. Second, the amendment is unnecessary because it duplicates a compensation program that already exists at the federal level. You can visit the website for the Health Resources and Services Administration's Countermeasures Injury Compensation Program at hrsa.gov/CICP if you want more information. And thank you to Representative Franson for mentioning that program. Finally, and probably most important, the COVID vaccines are safe. Millions of people in the United States have received COVID-19 vaccines under the most intense safety monitoring in U.S. history. COVID-19 vaccines were evaluated through clinical trials involving tens of thousands of participants. The vaccines met the FDA's rigorous scientific standards for safety, effectiveness, and manufacturing quality. There were comparisons made to cigarettes, but there is no comparison because commercial tobacco has no medically beneficial use. Vaccines save lives. There was a question asked saying essentially, can you imagine if tobacco was mandated? That's not relevant because there is no government mandate in place for the COVID-19 vaccine. Because of the safety of the vaccine and the existence of a federal compensation program, there is no need to divert funding from a critical program, and I encourage members to vote no.
Representative Franson.
Thank you, Madam Speaker. And before I continue on, I would like to request a roll call.
Representative Franson requests a roll call. Seeing 15 hands, there will be a roll call. Representative Franson.
Members, just last week we passed a bill that had $190 million in it for COVID response. I think we can take this issue very seriously, no matter your view on the COVID-19 vaccine. Put it this way. If there are no adverse reactions and nobody is getting sick from the vaccine, nobody's dying from the vaccine, your precious $5 million will not be touched. But we are hearing, and it's not just me, there are members not members, I shouldn't say members, there are individuals in this Capitol that have come to me and others here in this chamber about their reaction to the COVID-19 vaccine. There is a doctor from the Mayo who suffers from tendinitis. COVID-19 vaccine. As far as the mandates, Governor Walz himself played doctor and mandated that state employees, contractors, you name it, if they benefit from the state of Minnesota, they receive dollars from the state of Minnesota, they have to take the COVID-19 vaccine or be tested. Majority of people said, I'm just not going to deal with the weekly testing. I'll just get vaccinated. Some people left the state. The U of M, the regents, decided, you know what? We're going to mandate the COVID-19 vaccine as well for the students if they want to attend here. And at first, the U of M tried to ignore the religious exemption to the COVID-19 vaccine. This issue is real. Your vote today will determine if you are going to stand with Big Pharma or you are going to stand with the individuals who have taken the vaccine and did their part, but now suffer health effects. These data dumps are real. I believe there was another data dump of 80,000 pages done today from Pfizer. The studies are real. However, for some reason, phthalimide can be found unsafe. Vioxx can be found unsafe. Opioids can be found unsafe. But when it comes to the holy grail of a vaccine, the walls go up and the talking points of safe and effective come out. Members, I request a yes vote.
Seeing the member from Hennepin? No. Seeing no further discussion, the clerk will take the roll on the amendment. Members, please vote. Will the clerk please call the names of the members who've not yet voted?
Berg.
Berg, no.
Berg, no. Hamilton.
Hamilton, no.
Hamilton, no. Hausman.
Hausman, no.
Hausman, no. Moran.
Moran, no.
Moran, no. Pearson.
Pearson, aye.
Pearson, aye. Thompson.
No.
Thompson, no.
The clerk will close the roll. There being 60 ayes and 71 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Ackland moves to amend Senate File number 4410, the unofficial engrossment as amended. The amendment is coded A29.
The member from Nicollet, Representative Ackland.
Thank you, Madam Speaker and members of the House. The amendment before us, the A29, deals with the profession of physical therapy, deals with physical therapists. It, in a nutshell, removes access barriers for consumers that consumers face when working with a physical therapist. So just to clarify a little bit, physical therapists have been licensed in Minnesota since 2007. Both physical therapists and physical therapist assistants are licensed under the Minnesota Board of Physical Therapy. So briefly, I'm going to list 4 points that this amendment addresses, and then I'll go into a little more detail. But first and foremost, it removes the arbitrary access barriers to a physical therapist. Currently, in statute, there is a 90-day limitation and a 1-year prohibition on access to physical therapy without a referral from a physician or provider. Number 2, the bill clarifies current language to reflect the contemporary training and practice of physical therapists, particularly doctors of physical therapy. Number 3, the bill updates the current language to reflect contemporary training of physical therapy assistants and the collaborative team approach to both patient care and student supervision. And number 4, it provides protection within the profession and authorizes the Board of Physical Therapy to impose financial penalties on those who violate these protections. So, in a little more background, currently we have about 6,000 physical therapists and 1,700 physical therapy assistants licensed in Minnesota. These therapists actually practice in a variety of settings. You'll see them in hospitals, you'll see them in clinics, you'll see them in nursing homes, you will see them in emergency departments, you'll see them in sports facilities, you'll see them in private practice, and you'll see them in the military. So while most physical therapists work in healthcare organizations directly or through contracts, many physical therapists are in private practice. Physical therapists serve patients of all populations, and they are, the original language in this said they were for the purpose of preventing, correcting, or alleviating a physical or mental disability. The new language will also include a description of health promotion and wellness. So, the work duties of a physical therapist are similar to that of physicians and other non-physician providers trained at the doctor level. However, physical therapists in Minnesota are not allowed to similarly function at the top of their license. Physical therapists still require a referral to provide services beyond 90 days of treatment, even if the patient is benefiting from that treatment. So this proposal will not change the work duties, but instead it removes these access barriers that consumers face when they want to seek help from a physical therapist. Originally, a physical therapist was required to have a bachelor's degree. In the 1980s, physical therapists, the requirements were upgraded that they had to have a master's degree. Now, in 2016, all new physical therapists are required to have a doctorate. Beyond this doctorate degree, physical therapists can also participate in residencies, and they can participate in fellowships. So very well educated, and moving roughly about half of all physical therapists today have doctorate degrees. So these specialty areas that they can go into, and you see this, they can go into cardiovascular. I participated in a cardiovascular rehab session myself. They go into pulmonary rehab. I have a friend who's suffering from COVID. He's home, but he has to go through pulmonary rehab with the physical therapist. They specialize in neurology. A friend whose husband has Parkinson's. You know what? He needs help learning how to walk properly to prevent the falls. They're specializing in oncology, in orthopedics, in pediatrics, in sports, in women's health, and in wound management. So, this amendment doesn't alter anything doesn't have anything to do with the graduate program. These doctors, there are actually 5 schools in Minnesota that offer a doctorate degree in physical therapy. There's one in Mayo Clinic Rochester, St. Scholastica, University of Minnesota, Concordia, and St. Catherine's in St. Paul. So these physical therapists, they must first of all get their bachelor's degree. In addition, they must complete their doctorate degree. In addition, they have to have 60 hours. In addition, they have to pass their national exam. In addition, they must renew their license annually. They must have 20 hours of continuing education every 2 years. And they must pay an annual license fee of $60. So even though we have as that many physical therapists that I mentioned, the demand is growing. And right now we have 310 openings for physical therapists. So basically what we want to do with this, this amendment is just remove, and the language is in the bill, and it says the current language says the board may impose disciplinary action against a licensee who has treated human ailments by physical therapy after an initial 90-day period of patient admittance to treatment has lapsed, except by the order of a referring physician. So that language we want to remove and make the access available to patients without having to get that referral from their provider. There's some language, and I can go through it, but I don't think it's necessary. With telemedicine or telecommunication, they've made a few changes to how a physical therapist actually supervises other physical therapists and or supervises physical therapy assistants. So that is also in the bill. So as I think about this bill, and I wondered, you know, what's the holdup? Why would we not trust somebody with our musculoskeletal problems? Why would we not do that? And I think I've been a nurse for a long time, and I used to fill out these referrals to physical therapy. And you know what the doctor puts on there? We'd fill them out, and the doctor would sign it. When they went to physical therapy, what we said was evaluate and treat. The doctor doesn't specify he needs hot packs, he needs cold packs, he needs to be trained on a walker, he needs to, range of motion. They don't do that. They say evaluate and treat. That's what physical therapists are doing anyway. So we don't need somebody saying you need to go to physical therapy. People know when they need to go to physical therapy. So, so just in closing, I wondered, who would be opposed to this? So I read there was some concern that a physical therapist might miss a diagnosis. So you're treating somebody for, say, neck pain, and it turns out they have maybe something wrong with their, maybe they have some mets to their neck or something. You can imagine any kind of thing you want. The 20 states that have full access to physical therapy have not seen any of that arise. Because these physical therapists are well-trained, know what to look for, and know how to make the diagnosis, and would be more than happy to refer back to a provider if they felt that this was something beyond their scope of practice. So I look at it in another way, too. I thought, what did we do with nurse practitioners? A few years ago, in the 70s, we started training nurse practitioners, and they had 1 year of training, and then they went out and they practiced a form of medicine. Now, nurse practitioners have come further, and we have advanced practice nurses, et cetera. But it's sort of the same thing. You want to be able to practice up to your scope of practice, and I think that the doctorate level of these physical therapists absolutely reaches that point. and that they should be allowed to practice within their full scope. So I urge a yes vote on this. Oh, actually, I just urge a yes vote. Thank you.
Further discussion. Representative Howard, for what purpose do you rise?
Point of order, Mr. Speaker.
State your point of order.
I rise under Rule 3.21. Motions must be germane, and I have advice.
State your advice.
Mr. Speaker, after listening to the entirety of Representative Ackland's description of the amendment, first, I would say, as a son of a physical therapist, I was going to say, as a son of a physical therapist, I agree with almost everything Representative Ackland said. Unfortunately, this would expand the scope of the bill. It brings in Chapter 148, which isn't included in the bill, and so I'd ask that you find this amendment not germane.
Further advice to the point of order. I recognize the member from Otter Tail, Representative Rasmussen.
Thank you, Mr. Speaker. I just want to point out to members that Article 5 of the omnibus bill in front of us, I believe, has 8 bills in it that relate to licensure. They span everything from specialty dentistry to looking at pharmacists to podiatry. Article 5, is clearly shows that this bill before the House is dealing with scope of practice, and I would ask you to find the point of order not well taken.
I have reviewed the bill, I have studied the amendment, and I have heard advice from Representative Howard and Representative Rasmussen, and I find that the point of order is well taken. There's an amendment at the desk. The clerk will report the amendment.
Rasmussen moves to amend House File Number 4410, the unofficial engrossment as amended. The amendment is coded A28.
I recognize the member from Otter Tail, Representative Rasmussen, the author of the amendment.
Thank you, Mr. Speaker. This amendment is dealing with increasing access to high-quality eye care here in Minnesota. And I wanted to start with a story from a constituent who receives eye care in my community. She's required, as a part of her care, to receive a long-term daily oral medication for her eye health. And in 47 other states, she could receive this prescription from her optometrist. But because of Minnesota's limited scope of practice, she has to travel 6 hours round trip for a 5-minute appointment to get her prescription filled. And she writes to me that this, causes her to miss a day of work and has additional costs beyond the additional cost of the visit that she has. And she wrote in a letter, I plead with you to consider making access easier and allow my optometrist, who is trained and capable, to provide my care. And so this amendment is actually a Representative Richardson bill. It has 15 co-authors here in the House with wide bipartisan support, and it updates optometrists' scope of practice to allow them to utilize the training that they receive and the education that they have received to provide greater access and better care to Minnesotans. Many of the changes in this bill have already been adopted by 40-plus states, and so it is time for Minnesota to catch up and make sure that we're providing greater access to eye care across the state. I also want to point out to members that in 57 counties, optometrists are the only eye care provider in those communities. And in addition, a study from Avalon Health Institute has found that by increasing the scope of practice for optometrists, that it could save more than $600 million per year in transaction savings. And that doesn't even include the costs like my constituent who has to drive 6 hours for a 5-minute appointment. And so, Mr. Speaker and members, would ask support for this bipartisan proposal that will help improve access and reduce costs here for Minnesotans.
Further discussion to the amendment. I recognize the member from Hennepin, Representative Howard.
Point of order, Mr. Speaker.
Representative Howard, state your point of order.
I rise under a point of order under Rule 3.21. Motions and propositions must be germane, and I have advice.
Representative Howard, please state your advice.
Mr. Speaker, similar to the amendment prior, this brings in Chapter 148, a section of law on public health occupations. It's not included in this bill, and I'd ask that you find this amendment not germane.
Further advice to the Howard point of order. I recognize the member from Otter Tail, Representative Rasmussen.
Thank you, Mr. Speaker. And the advice that I would offer is, again, we have Article 5 of this bill that contains many different provisions touching licensure, touching scope of practice. And Mr. Speaker, I would ask you to find the point of order not well taken. I understand, that there isn't much in this bill that actually helps reduce the cost of health care, so there may be a germaneness issue there, but it's not on the amendment before the House today.
Further advice. I recognize the member from Traverse, Representative Backer.
Yeah, Mr. Speaker and members, I would just ditto that. I mean, we have various healthcare professions in this bill that talks about license. So this is germane. This is definitely not germane for the Agriculture Committee, okay? This makes sense here. I know the other side may not want to take a vote, but folks in my district, they're traveling miles and miles, and there's people who are not getting care because of it. So I would ask the Speaker not to find his point well taken.
I have reviewed the bill. I have studied the amendment. I have heard advice from Representatives Howard, Rasmussen, and Backer, and I find that the point of order is well taken. There's an amendment at the desk. The clerk will report the amendment.
Rasmussen moves to amend Senate File Number 4410, the unofficial engrossment as amended. The amendment is coded A6.
I recognize the member from Otter Tail, the author of the amendment, Representative Rasmussen.
Thank you, Mr. Speaker, and I would request a roll call vote on the amendment.
Representative Rasmussen requests a roll call vote. Seeing 15 hands, there will be a roll call vote. Representative Rasmussen.
Thank you, Mr. Speaker. The provider tax or sick tax is a tax essentially on all healthcare services provided in the state of Minnesota. And Mr. Speaker, I believe it's fundamentally wrong to tax Minnesotans because they're sick, whether it's a woman giving birth, someone seeking cancer treatment, someone with diabetes, or other Minnesotans seeking care. We should not be taxing them through the provider tax, otherwise known as the sick tax. And Mr. Speaker and members, this tax just in fiscal year 2025 is projected to bring in almost $800 million. That's $800 million of added cost to healthcare to Minnesotans when they are sick. And as we know in this body, we have nearly a $10 billion surplus. And so I don't believe that it makes sense for us to be continuing to overtax Minnesotans, especially in a way that drives up their health care costs. This tax was set to end until in 2019 when the Democrats pushed to extend it. And so we're giving the body an opportunity today to repeal the sick tax and to put more money back into Minnesotans' pockets. The amendment repeals the provider tax and would require DHS to present recommendations next session on alternative funding for the Healthcare Access Fund. And these recommendations must consider using existing funds and may not look to alternatives that would increase the cost of health care for Minnesotans. So I would ask for members' support on this common sense way that we can reduce the cost of health care, especially when we know Minnesotans are so concerned about the rising costs that they see in their day-to-day life.
Further discussion to the amendment. I recognize the member from Ramsey, the Majority Whip, Representative Herr.
Mr. Speaker, point of order.
Representative Herr, state your point of order.
So under Rule 3.21, motions and propositions must be germane. Advice?
Representative Herr, please state your advice.
So Chapter 295 is not in the bill, and so thus this would expand the scope, and I ask that you find the point of order well taken.
Further discussion. I recognize the member from Otter Tail, Representative Rasmussen.
Thank you, Mr. Speaker. Advice. The Healthcare Access Fund, which is where the revenue from the provider tax goes into, is mentioned at least 9 times in this bill. The bill also appropriates tens of millions of dollars out of the Healthcare Access Fund. The provider tax is germane because that's the funding mechanism that pays for much of the spending in this bill. And actually, Mr. Speaker, the DFL carried this extension of the provider tax in the HHS bill initially back in 2019. So if it was germane in 2019, I would hope that we're able to find it to be germane today. And so I would ask that you find the point of order not well taken.
Members, I have studied the amendment, I have reviewed the bill, and I have considered advice from Representatives Herr and Rasmussen, and I find that the point of order is well taken.
Mr. Speaker. I would appeal the ruling of the Speaker and would request a roll call vote.
Representative Rasmussen is appealing the ruling of the Speaker and requests a roll call vote. Seeing 15 hands, there will be a roll call vote. Further discussion, Representative Rasmussen.
Thank you, Mr. Speaker and members. I would ask for a red vote. I believe that Minnesotans ought to have the opportunity to have a vote today on repealing the provider tax. It is relevant to this huge HHS bill that we have, and I think the only reason to keep it off would be because there's nothing in this bill that actually helps Minnesotans afford their life, afford their health care. And so I'd ask members for a red vote today, overturn the ruling of the Speaker so we can have a vote on the provider tax.
Any further discussion? I recognize the member from Rock, Representative Schumacher.
Thank you, Mr. Speaker and members, and I would urge you to vote red on this and overrule the ruling of the Speaker on this. The Healthcare Access Fund, as Representative Rasmussen stated in his comments, is all over this bill in the spending and the line items. You can't turn too many pages without finding the Healthcare Access Fund listed in there, and for that reason, we should overturn the ruling of the Speaker. Thank you.
Further discussion. I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker, and I would urge members to uphold the ruling of the Speaker. This is clearly something that belongs in the Tax Committee. If there had been a bill, I don't know if there was, but it would have been vetted in the Tax Committee. This does not belong in the HHS bill. And I just want to say, when I look at this amendment, it really reminds me of what former President Trump did with healthcare. He said, oh, I've got great plans for you. I'm going to do great things for you. Let's repeal what we've got. And guess what? He never came forward with anything. So it's really easy to say, oh, we're going to give you something else. We're going to fix them. We're going to fill all these holes. Members, reinsurance just spent a bunch of the money in the Healthcare Access Fund. Reinsurance, which all the Republican members have been so hot on, or I shouldn't say all of them, I'm sorry. I know there are some who don't support it, but many of the Republican members, that was their primo solution for the cost of insurance, was reinsurance. And that spent money from the Healthcare Access Fund. So this is not germane to the bill, and it's a bad policy also. So I urge members to support the ruling of the Speaker.
Further discussion. I recognize the member from Lyon, Representative Swedzinski.
Thank you, Mr. Speaker. Advice. When you're looking at this amendment, and I want to just thank Representative Rasmussen for bringing it forward. I potentially agree slightly with Democrats in the idea that this amendment that Rasmussen is moving forward is probably one of the only things that would actually reduce the cost of healthcare in the state of Minnesota if it was to move forward. By cutting taxes on cancer treatments, by cutting taxes on treatments, it would actually cut it. Not just defer costs to someone else, but actually cut the cost of healthcare. And for that reason, I would agree with Democrats that it would be ungermane because it doesn't exist anywhere else in this bill. But it absolutely belongs in this bill, and it should be allowed to be voted on by this body because this what pays for this bill. And with that, I would ask that you would vote against the ruling of the Speaker. Thank you.
Any further discussion? I recognize the member from Isanti, the Minority Leader, Representative Dowd.
Thank you, Mr. Speaker and members, and thank you, Representative Rasmussen, for bringing this amendment forward. I would very strongly encourage members to overrule the ruling of the Speaker. This is pretty obvious. I mean, you can, just for effect, I'll hold up this bill. I don't know, somebody probably right now somewhere in this chamber is counting the number of times that this bill talks about the provider tax in it. But of course, when Democrats want to hide under their desks and not vote to actually reduce the cost of health care, we rule things out of order. First of all, this Oh, there we go. I don't want you to miss any of this. You know, good on you, though, for actually letting me know that my microphone had turned off. because I'm sure you don't want to miss this either. But the reality is this bill in itself is silly. I mean, it is. Look at it. I'm doing it again. It's a supplemental budget bill in the second year of the biennium, and this thing is, I don't even know how many pages. 875 pages. And you want to say that this bill, that an amendment on the provider tax isn't germane? If people are watching at home, you look silly. I mean, everybody can see what's happening. You've actually got an opportunity to vote on something that will reduce the cost of health care for Minnesotans in this state. No, out of order, out of order. We don't even want to take the vote. Out of order. It's not out of order. Nothing out of order about it. Everybody knows that. Look at the bill. Read it. I'd love to know how many pages you can get into this bill before you see the word healthcare access fund. I bet not very far. It's probably even in the title. But you don't want to vote for it. And like I said earlier, you've been very consistent. Every opportunity Democrats have voted in my time here in the legislature, every opportunity to raise the cost of health care. You literally are taxing people who are sick. This is the worst public policy in the history of public policy. You know what, though? People should pay their fair share, shouldn't they? They should pay their fair share. That's your motto. At least that's what it is out on the campaign trail, and that's what it is when there's a TV camera around. But you know what? When you're actually passing legislation in this chamber, it's tax the poor, tax the sick. Every regressive tax policy, the three most regressive tax policies that I could think of have been your top priorities since I've been here in the legislature. Number one, the sin taxes. Raising tax on tobacco, raising tax on cigarettes. I remember when you did that and you put an automatic inflator in place so it would just keep going up. You know who disproportionately pays the cigarette tax? Low-income people. Yep, I'm sure you just wanted to make sure they paid their fair share, though. Yep, make sure that poor people paid their fair share. And I hope that people at home are listening, because this will be a great tutorial on how hypocritical you are when it comes to tax policy, when it comes to actually making people pay their fair share. And then there was this, the provider tax. The sick tax, we used to call it. Taxing people who access health care. And the more you access health care, the more you pay. The sicker you are, the more you get taxed. And you know what? It's also one of the most regressive taxes you could put in place. So you don't get to call yourselves progressives anymore. You're regressives. That's what you are. You're regressives. Because you just want to make sure that poor people are paying their fair share. Yep, that's not the best one, though. The best one is your obsession and your addiction to raising the cost of gasoline by increasing the gas tax. So anybody watching at home, if you've paid $4 a gallon for gas, this crew right here, Democrats in the Minnesota House, wanted to make sure in the last couple of years that you would have paid, I don't know, 25 cents a gallon more? What was it? That was the number, I think. They've voted twice in the last 3 years to raise the cost of gasoline. And how many proposals do we have right now to do it? Introduced. Also, the gas tax, one of the most regressive taxes you could put in place, which means low-income Minnesotans will get hit hardest by that tax. So the cigarette tax, the gas tax, and the sick tax. 3 strikes and you're out. If you're low income in the state of Minnesota, Democrats, 3 strikes and you are out. This is the worst tax policy in the history of tax policy. Oh yeah, one of my members just handed me a receipt for gas, and I know this is true because I bought it last night too. $5.50 a gallon. $5.50 a gallon.
This is Representative Liebling.
Representative Liebling, for what purpose do you rise?
Mr. Speaker, what point of business, what order of business are we on here? We're hearing about gas taxes and so on. I thought this was an HHS bill.
Representative Liebling, the question before the body is, shall the decision of the Speaker stand as the judgment of the House? Representative Herr ruled the amendment, or asked that I rule the amendment out of order under germaneness, and now we are debating an appeal to the ruling of that Speaker.
Thank you.
Representative Dowd.
Thank you, Mr. Speaker, and I appreciate you understanding, like Minnesotans do as well, that the fact that Democrats want to make sure that low-income Minnesotans pay their fair share is absolutely relevant to this conversation. And it is 1,000% consistent. You know, saying that you know, you're out of order if you want to lower a tax and you want to make health care less expensive in the state of Minnesota. That's out of order. You're right. It is out of order because this bill will make health care more expensive in the state of Minnesota. So making health care less expensive absolutely would not fit in this bill. And maybe we just want to try one time to save Minnesotans some money on their health care, and particularly low-income Minnesotans, because that's who Democrats seem to want to target with their tax increases. And yes, this tax is just like the gas tax, and it's just like the cigarette tax, because it's regressive, and it's bad public policy. More bad public policy. I remember when Democrats tried to cut nursing homes $68 million too. That was genius public policy. Maybe just once you should listen to us and say, you know what? Maybe you're right. Maybe Minnesotans are getting hit too hard by inflation right now. Maybe they're paying too much for gasoline right now. Maybe they're paying too much for everything they buy every day. And maybe they could use a break on their health care. Maybe they could pay less for their health care. Or you can, uphold the ruling of the Speaker. You can rule this one out of order, and we can keep taxing the heck out of low-income Minnesotans. Make sure they pay their fair share. Make sure they pay their fair share. And for those of you watching at home, that's Democrats' tax policy. Every regressive tax that I can think of has been brought forward and pushed by Democrats in the Minnesota House. Because they talk a good talk out on the campaign trail, they talk a good talk in front of the TV cameras, but when it actually comes here to taking votes in the Minnesota House, they can't raise enough taxes on low-income Minnesotans. Regressive taxes, taxes that are terrible policy. So this vote right here is about actually reducing the cost of health care for Minnesotans. You've increased the cost of their gas, you've increased the cost of their cigarettes, you've increased the cost of everything they buy every day. And you've increased the cost of their health care. So this is your first opportunity, not your first opportunity, but this is the best opportunity today to actually give Minnesotans some help, to send them a lifeline. And you know what? The state of Minnesota has the largest surplus in state history. We have a 20% surplus. But this crew wants to make sure that, oh no, we can't reduce the cost of health care for Minnesotans. We need that money too. And we want to make sure we get most of it from low-income Minnesotans. That's where it comes from. We want to make sure that they pay their fair share. I don't, whatever. You do it if you want to. But don't you think for a second that we're not going to remind Minnesotans every day of the horrible policy that comes out of Minnesota House Democrats who want to make sure that low-income Minnesotans pay their fair share. I'll translate for you. That means that Democrats in the Minnesota House want to tax the heck out of low-income Minnesotans. So don't believe a thing they say out there to the TV cameras, because when they're here in the Minnesota House, here on the House floor, when they actually are confronted with the opportunity to lower health care costs for Minnesotans, out of order. And we're going to vote against actual Minnesotans. That's what you're voting against. You're not voting against me. You're not voting against Representative Rasmussen. You're not voting against the Speaker. You are voting against Minnesotans. So think about that, Democrats. See if you can be proud of that. Because not only do they pay more for their health care, they're going to pay more for their gas and more for their cigarettes. So the next time, Minnesotans, the next time you fill up your gas tank, just remember that it's not just Joe Biden, it's also Tim Walz, and it's also House Democrats. They're the ones who are responsible for the fact that you're paying so much money. Thank you, Mr. Speaker.
Members, I will remind us that the question before the body is, shall the decision of the Speaker stand is the judgment of the House? A yes or green vote supports the ruling of the Speaker, while a no or red vote goes against the ruling of the Speaker. The clerk will take the roll. Members, please vote. Will the clerk please call the names of members who have not yet voted?
Acom.
Acom, aye.
Acom, aye. Berg.
Berg, aye.
Berg, aye. Hamilton.
Hamilton, no.
Hamilton, no. Hausman.
Hausman, aye.
Hausman, aye. Moran.
Aye.
Moran, aye. Pearson.
Pearson, no.
Pearson, no. Thompson. Thompson.
Thompson, aye.
Thompson, aye. Zhang Ti.
Zhang Ti, aye.
Zhang Ti, aye.
The clerk will close the roll. There being 68 ayes and 63 nays, it is the judgment of the House that the decision of the Speaker shall stand. Members, before we move on to our next order of business, I would like us to pause and recognize two former members who are here in the chamber with us today. I'd like to recognize former Representative Andy Steensma from Laverne, who served this chamber from 1987 to 1994, as well as former Representative Ted Winter from Fulda, who served this chamber from 1987 to 2002. Members, let's rise and give them a round of applause. There's an amendment at the desk. The clerk will report the amendment.
Damath moves to amend Senate File Number 4410, the unofficial engrossment as amended. The amendment is coded A13.
I recognize the member from Stearns, the author of the amendment, Representative Damath.
Thank you, Mr. Speaker. And members, the A13 is an amendment that would that has to do with the licensure of certain facilities that perform abortions. We know that facilities that perform 10 or more abortions each month would need to be licensed by MDH. This amendment would require MDH to perform inspections and investigations of licensed abortion facilities and allows MDH to suspend, revoke, or refuse to renew a license for a facility that violates the law. Many states around us, including Wisconsin and South Dakota, but many states require abortion facilities to be licensed. This is about the health and safety of women. We require other facilities to be licensed, other healthcare facilities, so why wouldn't we expect the same of these facilities? And with that, Mr. Speaker, I would request a roll call and a green vote.
Representative Damath requests a roll call vote. Seeing 15 hands, there will be a roll call vote. Anything further, Representative Damath?
Members, I would encourage a green vote, please.
Any further discussion? I recognize the member from Hennepin, Representative Greenman.
Point of order.
Representative Greenman, state your point of order.
Mr. Speaker, I rise under Rule 3.21. Motions and propositions must be germane, and I have advice.
Representative Greenman, please state your advice.
After reviewing the bill and the amendment, it's clear that A13 is not germane to this bill. It expands the scope and brings in subject matters not in the bill. There's nothing in this bill about abortion regulation. The word abortion is not included in the bill. This amendment is not germane.
Further advice. I recognize the member from Stearns, Representative Damath.
Thank you, Mr. Speaker. This actually is completely germane, and I would find that you would take that advice not well taken. There's 17 sections of this bill that are in Chapter 145 where the new language would be placed. So, Mr. Speaker, I would encourage you to not accept that advice.
Members, I have studied the amendment. I have reviewed the bill. I have taken advice from Representatives Greenman and Damath, and I find that the point of order is well taken.
Mr. Speaker?
Representative Damath.
I would appeal the ruling of the Speaker and request a roll call.
Representative Damath is appealing the ruling of the Speaker and requests a roll call vote. Seeing 15 hands, there will be a roll call vote. Further discussion to the appeal. Representative Damath.
Thank you, Mr. Speaker. Members, this bill or this amendment has to do with the licensing of facilities that perform abortion. And I just want to go through a couple of things. We know that we in Minnesota license a number of facilities, and I'll just tell you a few of those. We have licenses for physicians. We have licenses for registered nurses, licensed practical nurses, dentists, pharmacists, audiologists, professional counselors, nursing services, long-term care services, ambulance services. Those are all included in this bill, including licensing for a children's hospital, immediate care facilities, facilities for persons with developmental disabilities, children's residential facilities, foster homes, adult foster care, adult daycare, assisted living, and more. That is already included in this bill, members. This amendment is completely germane, and I would encourage us to take the vote, to take a green vote on it as my recommendation. I would encourage you to vote red on the ruling of the Speaker, thank you, because this amendment is absolutely germane to the bill. Thank you, Mr. Speaker.
Any further discussion? I will remind the body that the question before us is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker, and a no or red vote goes against the ruling of the Speaker. Seeing no further discussion, the clerk will take the roll. Will the clerk please call the names of members who have not yet voted?
Berg.
Berg, aye.
Berg, aye. Hamilton.
Hamilton, no.
Hamilton, no. Houseman.
Houseman, aye.
Houseman, aye. Moran.
Aye.
Moran, aye. Pearson.
Pearson, no.
Pearson, no. Thompson.
Thompson, aye.
Thompson, aye. Zhang Ti.
Zhang Ti, aye.
Zhang Ti, aye.
The clerk will close the roll. There being 66 ayes and 65 nays, it is the judgment of the House that the decision of the Speaker shall stand. There's an amendment at the desk. The clerk will report the amendment.
Damath moves to amend Senate File Number 4410, the unofficial engrossment as amended. The amendment is coded A26-1.
I recognize the author of the amendment, the member from Stearns, Representative Damath.
Thank you, Mr. Speaker. Members, the A26 has to do with the use of family planning grants. What this amendment does is it prohibits family planning grants from being paid to organizations that provide, perform, or prescribe for abortions. It requires that organizations receiving family planning grants cannot refer patients to seek abortion services, engage in advocacy promoting abortion, or distribute materials about abortion. Members, we know that people who sincerely believe that abortion violates the right to life of an innocent human being should not have to have their tax dollars go to organizations who perform or refer for abortions. Many who support abortion do not support taxpayer dollars being used to support it. State family planning funds can instead go to organizations that do not do abortions. Those funds could go to county health departments or to other organizations. This can be done without reducing the amount of dollars that the state grants for family planning, and this is absolutely germane in case that comes up, members. We know in this bill alone, there is $3.5 million each year for family planning grants. So members, I would encourage a green vote, and Mr. Speaker, I would request a roll call.
Representative Damath requests a roll call vote. Seeing 15 hands, there will be a roll call vote. Any further discussion? I recognize the member from Hennepin, Representative Greenman.
Mr. Speaker, point of order.
Representative Greenman, state your point of order.
I rise under Rule 3.21. Motions and propositions must be germane, and I have advice.
Representative Greenman, state your advice.
After reviewing the bill and the amendment, the A26 is not germane because it expands the scope of the bill and brings subject matters that are not currently in the bill. There's nothing in this bill about abortion regulation. The word abortion doesn't appear in there in the 876 pages of the bill. This amendment is not germane.
Any further advice? Representative Damath.
Mr. Speaker, this is actually germane. As I mentioned in my opening statements on the amendment, this bill includes $3.5 million each year for family planning grants. There are 17 sections of the bill that are actually in Chapter 145 where this language would be placed. This is the Health and Human Services Omnibus Bill. And last year's HHS Omnibus funded family planning grants at MDH also. So, Mr. Speaker, I would find that you would take my advice well taken and you would rule in favor of letting us take the vote.
Members, I have studied the bill, I have reviewed the amendment, and I have considered advice from Representative Greenman and Representative Damath, and I find that the point of order is well taken.
Mr. Speaker.
Representative Damath.
I appeal the ruling of the Speaker, and I would request a roll call.
Representative Damath is appealing the ruling of the Speaker and requesting a roll call vote. Seeing 15 hands, so there will be a roll call vote. Representative Damath.
Thank you, Mr. Speaker. Members, this is absolutely germane. As I have mentioned, this bill already includes $3.5 million for family planning grants. This amendment is germane to this. 17 sections in the bill are in Chapter 145. I would request a red vote to rule against the speaker. And hopefully if we get that through, members, we would be able to just take a vote on the actual amendment. It has been frustrating over the last few days as we've heard different bills come through that we can't just take a vote. We serve our constituents in unique areas of our state, and all they want us to do is to do our job. I can go back to my constituents and defend a vote that I took either for or against something. But it's really frustrating to go back to my constituents and to say, I'm sorry, but the majority party wouldn't even let us take an actual vote on the actual item. So members, I would encourage you again to vote red against the ruling of the speaker. Thank you, Mr. Speaker.
Further discussion, I recognize the member from Hennepin, Representative Robbins.
Thank you, Mr. Speaker. And members, I rise in support of the effort to overturn the ruling of the Speaker. I've not spoken on any of these omnibus bills, and I've been trying to be very restrained, but this is crazy, members. We are a deliberative body, and every time we bring up an amendment, it is ruled out of order, even though it is germane, and everybody knows it. Members, you are stifling the debate of the minority, and it is so frustrating. I know I've only ever served in the minority, and I hope we treat you better than you treat us when it is our turn, hopefully, to someday serve in the majority. But this is crazy that we are not allowed to vote on these amendments. I get you don't support it. I get you will win those votes. But members, we are a body that deliberates on important issues for our constituents, and constantly ruling things out of order just demeans our offices, demeans this body. And I ask you, members, to vote with us to overturn the ruling of the Speaker. We cannot have this continue day after day for the next 3 weeks, members. We have to be able to have these discussions in front of the public so they can hear our remarks. And I urge everyone to vote against the ruling of the Speaker.
Further discussion, I recognize the member from Chisago, Representative New Brindley.
Thank you, Mr. Speaker. I think, Representative Greenman, you were reading from the wrong script. I'm not sure how we came up with the idea that this would possibly be ruled out of order, or perhaps you did not get the memo after caucus that one of your amendments was not actually offered earlier. Initially, there was an amendment to the amendment offered that was clearly withdrawn, the A35 to the A15 amendment, which would have removed the funding for the family planning grants. And that actually would have made this amendment out of order. So I can understand why maybe there was some confusion. Perhaps your caucus discussed this with a plan to remove the family planning grants from the bill. However, that amendment was never offered. That amendment was never offered. It was never adopted. So now the majority is trying to say that an amendment, the Representative Demuth amendment, the A26, which is about family planning grants, is out of order when family planning grants are in the bill. The amendment literally deals directly with something that is in the bill. And all it does is determine, it adds some parameters. It adds some parameters around what is already in the bill. Like, this is the most nonsense argument I've ever heard. The fact that this would be considered not germane, it's clearly germane. It is clearly germane. The family grant funding, the family planning grant funding is in the bill. Again, there was an A35 amendment that was a Representative Liebling submitted, but did not offer on the House floor. That amendment was never offered, and at this point, that was an amendment to an amendment, so that clearly is not going to be offered. The other amendment, the A15 amendment, has already been adopted. The amendment to the amendment, that ship has sailed. The amendment to the amendment did not go on the bill. So again, I can see why you might be confused about thinking that this amendment is out of order. Because again, if the A35 had been adopted, that would have made this amendment out of order. And frankly, we discussed that as a caucus and we understood that. We knew that that would be the case. We understood that. We knew that that was going to be the case and we were prepared for that. That's fine. We understand there is supposed to be a strike zone. We get that. And we knew that if the A35 was adopted, we would be outside of the strike zone. We get that. We understand that. However, the A35 was not adopted. And that was offered as an amendment to the amendment. The underlying amendment was already adopted. So therefore, this language cannot go on the bill. Representative Damon's A26 amendment is clearly germane. It is clearly germane to the bill, and members should vote no to appeal the ruling of the Speaker. Thank you, members.
I recognize a member from Hennepin, Representative Greenman.
Thank you, Mr. Speaker. And I just want to make sure people remember, we're not talking about amendment to the amendment. We're talking about this amendment, which is not germane. A subject matter which is different from under consideration must not be admitted under the guise of being an amendment. This brings in the policy and topic area of abortion regulation. Abortion regulation is not in this bill. It is not in any of the 876 pages of this bill, and that makes this amendment not germane. And members, I'd ask for a green vote.
Any further discussion? I'll remind the body that the question before us is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker, and a no or red vote goes against the ruling of the Speaker. The clerk will take the roll.
It's going to be the same vote. 70 to 60, 60 to 70.
Would the clerk please call the names of members who have not yet voted?
Berg.
Berg, yes.
Berg, aye. Davids.
Davids, no.
Davids, no. Hamilton.
Hamilton, no.
Hamilton, no. Houseman.
Houseman, aye.
Houseman, aye. Moran.
Aye.
Moran, aye. Pearson.
Pearson, no.
Pearson, no. Thompson. 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 Bolden. Bolden. Bolden, aye. Thompson. Okay. Thompson.
The clerk will close the roll. There being 66 ayes and 66 nays, it is a judgment of the House that the decision of the Speaker shall stand.
Mr. Speaker, point of order.
Representative Dowd, state your point of order.
A motion in this body, a tied vote does not pass. This was very clearly a motion to sustain the ruling of the Speaker. You said it 2 times on this vote that a green vote would uphold the ruling of the Speaker. There was not enough green votes to uphold the ruling of the Speaker. This motion does not pass. A tied vote does not pass in this chamber, and it never has. And our rules are very clear about that. So my point of order is you read the board wrong. You said that this sustained the ruling of Speaker. It does not. It absolutely does not sustain the ruling of Speaker. A tied vote does not pass. You said yourself twice that a green vote upholds the ruling of the Speaker. There were not enough green votes to uphold the ruling of the Speaker. According to your calling out what this motion was and the way you described it to this body, you said a green vote upholds the ruling of the Speaker. The vote is still on the board. It's 66 ayes and 66 nays. There were not enough green votes in this chamber to uphold the ruling of the Speaker. And you made an error in saying that this motion passed. It did not pass. This is a motion, and you read it yourself. You read it back to the body twice. So you read it wrong. I'm instructing you now to change the way that you read this. You don't get to make up rules on the fly here. A tied vote does not pass. It never has.
Mr. Speaker, advice?
Representative Winkler, we're under a point of parliamentary inquiry.
We're under a point of order.
Okay, Representative Winkler, state your advice.
Mr. Speaker, advice to the doubt point of order. This is an appeal of the ruling of the Speaker. A majority vote of those voting is required to overturn the ruling of the Speaker. Representative Dowd's point of order is incorrect. Your ruling and announcement of the roll call vote was correct.
Advice, Mr. Speaker.
Representative Dowd.
You just said it wrong yourself, Representative Winkler. You said that this was a motion to overturn the ruling of the Speaker. And the Speaker read this, and he read it twice during the vote. He said a green vote upholds the ruling of the Speaker, and there were not enough votes to uphold the ruling of the Speaker. 66 votes does not uphold the ruling of the Speaker.
Members, I have listened to advice from Representative Dowd. I have listened to advice from Representative Winkler. I have consulted Mason's Section 234, vote on an appeal. A tie vote sustains the presiding officer, since a majority is required to overrule the presiding officer's decision. After reviewing this section of Mason's and listening to the advice, I find that Representative Dowd's point of order is not well taken.
Mr. Speaker, I move to appeal the ruling of the Speaker, and I request a roll call vote. And we might be doing this a lot today.
Representative Dowd moves to appeal the ruling of the Speaker and requests a roll call vote. Seeing 15 hands, there will be a roll call. Any further discussion?
I'm right here.
Representative Dowd.
Thank you, Mr. Speaker. Members, it's just easier to take a vote. I will tell you that this point of order, this point of order by one of the members on the Democrat side of the aisle is the most egregious one that I have ever seen in my time here in the legislature. Saying that this is not germane to the underlying bill when this particular amendment—
Point of order, Mr. Speaker.
Representative Winkler, state your point of order.
Mr. Speaker, the issue before the body right now is whether your decision on Representative Dowd's point of order related to the number of votes required to overturn the ruling of a speaker is the only issue in front of us. The germaneness point of order raised by Representative Greenman, the decision of the body about that germaneness vote is not in front of us. The only question for debate is Mason's Section 234.
Actually, Mason's Section 234
Representative Dowd, I have not recognized you. Are you seeking recognition?
I think you know that I am, Mr. Speaker.
Representative Dowd, advice to the Winkler point of order.
Thank you, Mr. Speaker. Actually, again, Representative Winkler is wrong. That section of Mason's was never raised during the debate on this issue. You said that is the only thing that's germane here is that section of Mason's. It was actually never raised in the debate. What is germane here is the fact that we had a motion, and if my staff could ask the front desk for the language that was read by the Speaker on this motion. There's a script up there. I'd like a copy of it, please. And I'll read it to the body. Because I listened very carefully. If you can get me that script, I'd appreciate it. So the language that was read, the question before the body, shall the decision of the Speaker stand? That's the motion. That's what a question is. A question is a motion. So the motion was, and the Speaker read this. The Speaker reads it every time. There's a script that sits at the front desk. And the language that was read by the Speaker is, shall the decision of the Speaker stand as the judgment of the House? That was the question before the body. That question does not pass on a tie vote. Nothing in this chamber passes on a tie vote. It was a question before the body, and the question was, and this was read twice by the Speaker on this issue, shall the decision of the Speaker stand as the judgment of the House? That was the question before the body. A yes would have said, yes, the decision does stand. And this motion did not pass. This question did not pass because there were 66 in favor and 66 against. Never in this chamber does a tied vote pass. And the question is very clear. So suggesting that there was some other question or some other motion before the body is absolutely incorrect. This was the question. I'm holding in my hand the exact script that was read by the Speaker of the House. The question for the body is, shall the decision of the Speaker stand as the judgment of the House? A yes vote would uphold the ruling of the Speaker. A no vote would go against the ruling of the Speaker. That was the question before the body. Shall the decision of the Speaker stand as the judgment of the House? A majority of this body did not affirm that. A majority of this body did not vote in favor of that question. So that question does not pass. and to say that there was anything else before this body is wrong. Our Speaker clarified it twice. Shall the decision of the Speaker stand as the judgment of the House? Suggesting that this question passes because it tied is an abomination of any rule that's ever existed in this body. This is the foundation. This is it. You want to suggest that all of a sudden, if you don't get enough votes, things pass in this chamber? You are dead wrong. And if you don't think World War III is coming on this issue, you are wrong. You lost. The motion failed. On a tie vote, motions in this body fail, period, without question. And I'll tell you, in my 12 years in this chamber, I've never seen this situation where a majority is so brazen and they can't scrounge up the votes on their side, so they actually rule that a motion that failed passed? Are you kidding me? There was no other question before this body, and our Speaker was very clear about it, and he read it right before you voted. The question before the body is, shall the decision of the Speaker stand as the judgment of the House? That's the question that was before this body. Listen very closely to the way that it's worded. Shall the decision of the Speaker stand as the judgment of the House? It requires an affirmative. Even the wording of the question requires an affirmative vote for the decision to stand. It's not worded in a negative context, it's worded in an affirmative. It requires an affirmative. It requires the body to affirm the Speaker's decision. That's why it took a green vote to say, yes, we agree with the Speaker. But unfortunately, there weren't enough green votes to agree with the Speaker. Shall the decision of the Speaker stand as the judgment of the House? I have a feeling tomorrow, and I'm going to do it just for fun, we're going to hear a different script when this question's read tomorrow. Shall the decision of the Speaker stand as the judgment of the House? 66 people said yes, but 66 people said no. So the question fails. And the question was clear. Shall the decision of the Speaker stand as the judgment of the House? And I will tell you, I didn't think that I would serve in this chamber at a time when a motion that fails is ruled to have passed. So, members, I think it's pretty obvious, because I think we all know that the underlying question that caused us to get to this point was clearly an overreach by the majority. And now, on top of that, we have an ultimate overreach. I think at some point, you have to recognize that this institution is bigger than your ambitions or your desire for the outcome that you want. This is a place where we debate. And this is a place where the people's voice advances. But it actually requires a majority. So I think you need to just check yourselves, because you appear to be drunk with power right now. And I want you to ask yourself, what would have been the outcome had we just actually followed the rules of the House and allowed an amendment into a bill that was very clearly germane, would it have been the worst to just debate that issue? And for those that are watching at home, all of this now is just about procedure. We're not serving Minnesotans. We're not actually debating the tough issues of the day. We're just talking about whether it's okay when you want to get your way so bad that you trample on the rules and you... What would have been the big deal to just take the vote? And I think it's pretty obvious now that we know you didn't have the votes. That's why you didn't want to take the vote. So you're going to use procedural motions. You're going to, tie vote passes here in the House today. Tie vote passes. You know what? A tie vote never passes in the House, ever. And so when any of you on that side of the aisle want to stand up and disagree with me right now, before you say whatever it is you're going to say or whatever book you're going to read, I want you to read the question that was before the body. Shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. By the way, there was not enough yes votes to support the ruling of the Speaker. In fact, even the Speaker voted on it. Both of them. Our Speaker Pro Tem voted on it, and our Speaker voted on it. And there wasn't enough votes to uphold the ruling of the Speaker. The question wasn't, should the ruling of the Speaker be overturned? The question that was read by the Speaker as the question before this body is, shall the decision of the Speaker stand as the judgment of the House? It requires an affirmative vote to uphold the ruling of the Speaker. That's why it took a green vote if you wanted to vote with the Speaker. There were not enough green votes to uphold the ruling of the Speaker. So you can invent whatever you want, because it looks like that's the territory that we're in right here. And you're just going to do whatever it is that you want to do. I even asked the staff at the front desk, and I got the answer, which is the same answer it's always been in this chamber, that a motion fails on a tie vote. So this one failed. Our Speaker decided to get creative and say that it didn't. And here we are, where you're going to declare you've won even when you didn't have the votes. It's pretty shocking. So members, this is your opportunity to right your wrong. I have a feeling there's a few more people that are going to want to speak to this. But it's about time you acted like the adults you want to be. And respect the place that you work and the rules which govern the work that we do. And we talked about this the other day. It's just easier to debate the issues and vote on them. And it looks like you want to create some new precedents today. So I have a feeling tomorrow when we come in, we're going to have bills that pass with less than 68 votes, and we're going to have motions and amendments that go on with, or, motions that have amendments that have 70 votes and 72 votes that are going to be, nope, sorry, that motion fails. That's the future of the House of Representatives. So vote very carefully on this. You're choosing your future. But I'd ask you very clearly to vote red. We got the same question before the body right now. Do you mind, Mr. Speaker, if I read it since I've got your script in my hand right now? Then you won't have to. So right now, the question before the body right now is, shall the decision of the Speaker stand as the judgment of the House? That's the question that's before the body right now. I'm going to ask you for a no vote. Not that it matters how you vote on this one, because the Speaker's just going to do whatever he wants, right? He's going to call it however he wants to. A yes vote or green vote supports the ruling of the Speaker. And a no or red vote goes against the ruling of the Speaker. I look forward to the new script tomorrow. I think you know how to vote on this. A red vote is what you have to do.
I recognize the member from Hennepin, the Majority Leader, Representative Winkler.
Mr. Speaker, members, in case you think that repetition and yelling is persuasive, I thought I would return us back to Mason's Section 234, and I will read it. 1/2 of the votes, legal votes cast, a quorum being present, sustains a decision of the presiding officer on appeal. A tie vote sustains the presiding officer, since a majority is required to overrule the presiding officer's decision. I will state that again. A majority is required to overrule the presiding officer's decision. The question that we are deciding now is whether Mason's Section 234 governs, or whether a generalized statement that this is a motion, which it is not, it's an appeal, should be the standard. And we do have custom and usage and precedent for this, dating back at least to, well, I don't even see what year this was. May 1st, 2006, the speaker was Svigum, and on a 65-65 vote, the decision of the presiding officer was sustained, just like today. This is how it is done in this body. It is according to rule, and the comments about motions are completely irrelevant to the decision of this body to sustain the speaker's ruling. I ask you to vote green on this appeal.
Further discussion to the appeal. I recognize the member from Anoka, Representative Raleigh. I recognize the member from Olmsted, Representative Liebling.
Pass, Mr. Speaker.
Further discussion to the appeal. Before we vote, members, I will remind us that a question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. The clerk will take the roll. Will the clerk please call the names of members who have not yet voted?
Berg.
Berg, yes.
Berg, aye. Bolden.
Bolden, aye.
Bolden, aye. Davids.
Davids, no.
Davids, no. Frazier.
Frazier, green.
Frazier, aye. Hamilton.
Hamilton, no.
Hamilton, no. Houseman.
Houseman, aye.
Houseman, aye. Moran.
Aye.
Moran, aye. Pearson.
Pearson, no.
Pearson, no. Thompson.
Thompson, yes.
Thompson, aye.
The clerk will close the roll. There being 70 ayes and 63 nays, it is the judgment of the House that the decision of the Speaker shall stand. There's an amendment at the desk. The clerk will report the amendment.
Haley moves to amend Senate File Number 4410, the unofficial engrossment as amended. The amendment is coded A11.
I recognize the author of the amendment, the member from Goodhue, Representative Haley.
Thank you, Mr. Speaker. So moving on with this 876-page HHS bill that does nothing to address the most urgent thing we are facing in health and human services. My amendment, the A11, would require that the data that's used for rates in the DWRS system are based on updated data rather than what we have today, years old, that hasn't been updated. And it would require that providers use at least 80% of the increase in these rates to their reimbursement to increase rates and benefits of their workers. And Madam Speaker, sorry, I need to look up and see the change there. Madam Speaker, I would request a roll call on my amendment.
Representative Haley requests a roll call. Seeing 15 hands, there will be a roll call. Representative Haley.
Thank you, Madam Speaker. In the opening this morning, when Representative Liebling and Representative Schultz were talking about this bill, you both referenced, and I wrote this down, that this bill sustains our healthcare workforce, and that this bill provides historic investments in our healthcare workforce. So I would like that clarified. So if Representative Schultz would yield to a question, Madam Speaker.
She will. Representative Haley.
Thank you, Madam Speaker, and thank you, Representative Schultz. And Representative Schultz, you had funding in the original bill, and that's why I wanted to call on you first, because it was deleted when it then left the Health and Human Services Committee. But you mentioned in the Ways and Means Committee that there were actually rate increases for DWRS system. So I'd ask you to clarify that if you would.
Representative Schultz.
Thank you, Madam Speaker. Let me clarify my earlier comment. I said this bill makes historic investments in human services that help people every day, older adults and people with disabilities. And let me just clarify what we're doing in this bill to help people with disabilities. We are including an employment exploration service base wage index increase. We are increasing the number of hours that family members can assist their loved one with a disability. We are adding the ability to get reimbursed for PCAs who drive their clients. We are increasing the reimbursement rate for home care services, a rate that hasn't increased in many, many years. We're adding shared services, which expands the options for people to live in their home to share services. We're developing MA waiver service for life sharing, directing DHS to develop recommendations to establish life sharing as covered as an MA waiver service. We're increasing reimbursement rates for consumer-directed community supports. This allows people to stay in their homes, which is what they wish to do, to live more independently and get the services that they need. We are including an ICFDD rate study in our bill. We're creating a task force on disability services accessibility. We're including the American Indian culturally responsive rate in EIDBI, which is early intensive developmental behavioral intervention services, to promote culturally responsive care that is offered to American Indian children. We're adding the Center for Excellence in Supported Decision-Making funding, granting volunteers to a grant to Volunteers for America to assist older adults and people with disabilities to avoid unnecessary guardianship through using less restrictive alternatives. We're including language to establish a PACE program, which is a program of all-inclusive care for the elderly. We're increasing the reimbursement rate to increase wages for personal care assistants. We are adding, expanding the CDCS program, like I said. We're doing a lot in our bill to help people with disabilities thrive. That's what we're doing in our bill.
Representative Haley.
Thank you, Madam Speaker. And Representative Schultz, I don't know that that completely answered my question. So I'd like to give the body a little history of the reimbursement rates for DWRS. 2000, I'll go back a ways here. 2009, a 2% increase. 2010, a 2.58% rate reduction. 2011, a 0%. 2012, a 1% rate reduction. 2013, 0%. 2014, 1.67% rate reduction. I went back 14 and a half years looking at these reimbursement rates. And it nets out to an average increase of about 1% per year. This is an unsustainable model. And not one of the things that you mentioned, Representative Schultz, will do anything to help these people who are disabled that live in our home and community-based services stay in these homes where they're provided phenomenal care and where they're living an independent life and where they're able to participate in the community. Not one thing in this 876-page bill is going to address this crisis, nor address the crisis in our nursing homes. A crisis which in our nursing homes we've been fighting against for years, including the $68 million in cuts that you proffered last session. I have files and files and files and letters and letters and letters from people in my community. Katie's parents, who sent me this very nice card. Katie's parents, as a parent of our beautiful daughter who resides at Great River Homes, we can't begin to tell you how positive it is for Katie to experience life outside of our home. Since she was at a very young age, we knew it wasn't realistic for her to live with us forever. The independence and growth she has experienced is amazing. The concern about that need being available to her and others right now is unimaginable. Many of these individuals do not have family who can even take them back home when these facilities close. And it's not if these facilities close. They are closing. 74 residential settings closed in the fourth quarter of 2021. Through April 1st of this year, we lost another 58. And in a survey that was just done, I guess it was this winter, we have 3,500 people on waiting lists to access these services. 3,500 disabled Minnesotans. And we are doing nothing in a Health and Human Services bill today to solve this problem. This is a crisis, members. The governor called in the National Guard this past year to help in long-term care facilities and nursing homes. This is a crisis of equal, if not greater, magnitude, and the majority party is doing nothing in an 876-page bill that spends $2 billion. But it does add a lot of staff to DHS and MDH. I added up the numbers. 1,289 additional full-time staff to DHS and MDH, and we can't fund people through the grace of God deal with those that are the least among us. If government cannot help, what are we here to do, members? This boils my blood that we are not addressing this issue. And we've had an entire session to talk about it. And Representative Schultz, to your credit, it was in your bill at one point. I don't understand how it got taken out. For additional programs, additional staff to the government agencies, but we're not willing to uphold people who currently start at $10.85 an hour to take care of the disabled. I'm embarrassed. And I will keep fighting for these folks. And these folks live in each one of our communities. They live in our neighborhoods. We have 1,500 provider organizations across the state of Minnesota that serve 73,000 people with disabilities. There, but for the grace of God, go I or my children or your grandchildren. We must stand up for them and speak for them in these chambers. And with a $10 billion surplus, This should be the first thing, the first problem that we solve. And it's doable, Representative Schultz and Representative Liebling. It's doable because you had the language and you took it out. So I'm standing here today to voice support for our nursing homes, again, which you tried to cut at $68 million last time. Thankfully, we stopped that. And I hope we will stop this ill-conceived idea this session as well. Where will these people go? I have an email, again, from my file. This is not made up. This is from an employee. 2 individuals today were taken out of our house by police officers and taken to a correctional facility. They are being kept at a correctional facility because there's nowhere else in our community for them to be housed. Can you imagine if that was your child, your neighbor? These facilities are closing and more will close, and they will be housed in hospitals or correctional facilities because there aren't other places for them to live. Many of these folks have elderly parents as well that have no means or even the physical capability of taking their children back in their home, even if as much as they want to. We must not let this session pass without addressing this issue. I ask for a green vote on my amendment, and let's take a stand this afternoon. Add this to the bill. 876-page bill. Again, let's address the biggest workforce crisis in healthcare right now. Thank you, Madam Speaker.
Representative Schultz. Thank you, Madam Speaker. Members, please vote no on this amendment. We're putting close to $500 million to address the healthcare workforce shortage. $500 million. This DWRS, Disability Waiver Rate System, we've invested hundreds of millions of dollars in this system in the past. They're getting a 10% increase this year in their reimbursement, a 10% increase, automatic inflationary adjustment. And they'll get another large increase in 2 years. We moved up that increase so they could get it earlier. Every single Republican in this body voted no on those increases last year. Every single Republican. So if you're serious about caring about people with disabilities, you should have voted yes. It was another incredible HHS bill last year, but you all voted no. We're also increasing the elderly waiver rate reimbursement system in our bill. This is a waiver program to allow people to stay in their homes where they want to live and avoid going to a nursing facility. The increase in personal care assistance, we have a 13,000 people shortage for PCAs. People want to stay in their homes and have PCA services. That's why we're increasing the reimbursement rate in our bill. They were only getting a 12% increase compared to the 27.1% increase in the DWRS system. They're making half of what the direct support professionals make per unit. 42% lower rate for PCAs than DWRS services. That's where the need is greatest, is increasing PCA wages. So members, please vote no. There is a lot in that 887-page bill. You've had time to read it, I hope, today. I can't list every single thing we're doing for people with disabilities, older adults, people across our state, but you should read that bill. The spreadsheet alone is 25 pages. So members, please vote no on the amendment so we can pass the bill. The member from Isanti, Representative Johnson.
Madam Speaker, members, Representative Haley, thank you for bringing this forward. I'm going to tell you a story about what's going on in this field. I've been contacted by many of my friends and many workers in my community that work in these homes. My family has a bowling center, family entertainment center, where these individuals get a day out, they come to the bowling center and do adaptive bowling. At one point, a couple years ago, out of our 16 lanes, we had all 16 lanes used for this program. We're now down to 3 lanes. Not because they don't want to come and bowl and have some fun and meet their friends, because they don't have the staff to get them there. I was talking to a friend of mine, Nick, the other night, who works in one of these places. He was doing a 48-hour shift. 48-hour straight shift because they don't have staff and they cannot leave these individuals by themselves. We're past crisis mode in this area. Representative Haley, thank you for bringing this forward because it's important. So when these kids, these individuals come out to the bowling center to have some fun, they are having a blast. I'm going to tell you a story about Richard. Richard started the program probably 17 years ago. He ended up bowling in the Special Olympics, which were held at our center. We've done it many times. We want to continue doing that. But Richard and his friends had so much fun in the adaptive bowling, they actually joined our regular leagues. They actually won the league championship. And Richard was a blast. Unfortunately, he passed away this past year. Some of you have probably seen Richard, especially if you know Andre the Giant, because he was one of those persons that always wrestled him. He had a heart of gold. But it was because of the staff helping them, getting them through all the things that they needed help with day by day, that allowed them to enjoy life. They were great people. Whenever they're at the center, I try to be there to be with them because they give so much joy and excitement to everybody. The staff are there because they enjoy working with those individuals. But they're in crisis mode, they're getting burned out. We need to get this on the bill, get those individuals the pay they need and the help they need, because it's that important to their way of life. A lot of these are there not because they want to be, it's because their families can no longer support them. I went through that with my cousin Mary. She lived at home as long as they could until her parents, my aunt and uncle, were no longer able to do the proper care for her, and she had to go into the home. It's nice that you want to help people stay in their home longer, but at some point, it doesn't work. And if we don't have these facilities available, what are we going to do? Just throw them out on the street? We can't do that. But these are important facilities that are in actual past, well, they're actually past crisis mode. They're in implode mode if we don't do something. So please vote green on this amendment.
The member from Douglas, Representative Franzen.
Thank you, Madam Speaker. And Representative Schultz, of course you voted no on your bill last year. Remember in 2019? You tried to cut nursing homes by $68 million. And now to this day, we're still not sure what you are trying to accomplish when passing these massive, gigantic health and human services bills. Gigantic. You ruined our trust when you attempted to slaughter our nursing homes by slashing their budgets by $68 million. Now today, They need that $68 million. They need $68 million. They need more money. This is a promise that we have made to our grandmas and our grandpas, that we would take care of them in their final days. So members, I ask you to support the amendment. Thank you.
Any further discussion on the Haley amendment? Representative Haley.
Thank you, Madam Speaker. I just wanted to clarify that the figures that Representative Schultz was throwing out, I have a discrepancy in those figures, but also that that's one-time funding. What my amendment does is solves this problem with permanent funding increases so that these homes can stay open and they can continue to staff as how they're needed to staff. Again, this workforce shortage is in crisis mode. And if we do not act, there's no place for these folks to go. That's your responsibility today in this vote. I urge a green vote. Thank you, Madam Speaker.
Seeing no further discussion, the clerk will take the roll on the amendment. Members, please vote. Go ahead.
Thank you.
Will the clerk please call the names of the members who have not yet voted?
Bolden.
Bolden, no.
Bolden, no. Davids. Davids. Hamilton.
Hamilton, aye.
Hamilton, aye. Houseman.
Houseman, no.
Houseman, no. Moran.
Moran, no.
Moran, no. Pearson.
Pearson, aye.
Pearson, aye. Thompson.
Thompson, no.
Thompson, no. Davids.
The clerk will close the roll.
Thanks.
There being 63 ayes and 69 noes, the motion does not prevail. The amendment is not adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File Number 4410, as amended.
Third reading as amended. Discussion to the bill. The member from Hennepin, Representative Howard.
Thank you, Madam Speaker, and thank you, members. I wanted to take a few minutes to talk about the ways that this bill is going to lower health care costs for Minnesotans, in particular their prescription drug costs. We've had a discussion today. I think members broadly have talked about wanting to make health care more affordable for folks. Voting yes on this bill will absolutely make health care more affordable for Minnesotans and ease the squeeze that families are facing in this important time. Members, prescription drugs has been an area where we've done really important, good work together on a bipartisan basis over the last few years. We passed legislation to reform our pharmacy benefit managers to add transparency through Representative Morrison's drug transparency, and we passed a nation-leading insulin affordability law here in Minnesota. But we know that that's not enough. When you talk to your constituents, we hear from folks time and again that the cost of prescription drugs continue to skyrocket. In fact, 143 of the most widely used and available brand name drugs have increased in price over 300% in the last decade. We need to do more. And that's what this bill does. We are taking steps to, on the issue of price gouging, the kind of abusive practices we've seen with EpiPens and other issues and life-necessary drugs. Representative Morrison's Drug Affordability Board adds power and agency to Minnesotans against the powerful drug companies. And this bill includes legislation that I've authored to cap the costs, the insurance costs of insulin, asthma medications, and EpiPens at $25 a month for Minnesotans. And that bill, importantly, also caps the cost of medical supplies, an issue that doesn't get enough attention. Members, as I've talked with folks, it's not just the cost of the drug that continues to increase, it's the cost of the supplies. Families are spending thousands of dollars to manage their diabetes, and when I've talked to doctors, they've often had to prescribe a form of treatment that is not the preferred path just because it's cost too much. And members, that should never happen. The treatment plan between a patient and a doctor should be what carries the water, not the dictation of an insurance company. And so this bill takes care of that. You know, as I've mentioned, members, this is an area where we've done good bipartisan work to lower the cost of prescription drugs, and collectively that's what this bill does. It should be an area that we can rally around, which is why I was disheartened to see that our friends on the other side of the aisle attempted in committee to extract every single piece of this bill that would make it easier to lower the cost of prescription drugs. Thankfully, that amendment was defeated, and it was defeated because House Democrats will not do the bidding of big pharma and big insurance companies. And so, members, this is a clear whose side are you on moment and a whose side are you on bill. If you want to stand with Minnesotans who are struggling with the high cost of prescription drugs, vote yes on this bill. If you want to stand with big pharma and big insurance companies, vote no. I know how I'm voting.
The member from Nicollet, Representative Ackland. The member from Sibley, Representative Gruenhagen.
Well, thank you, Madam Chair and members. Yeah, I do have a number of concerns about this bill, and I'll give you a little history on why those concerns I think are valid to both sides of us on the aisle. You know, I got an analysis of the history of welfare spending here in the state of Minnesota. And according to this analysis, in 2014, we were spending on our public welfare program per person $14,020 per person in the state of Minnesota. We are ranked number 4 in the nation, according to this analysis. By the year 2019, we were spending over $550. So from 2014, we went from $14,000 all the way up to over $26,500 on our welfare programs. We moved from number 4 to number 2. We're just behind California, members. That was in 2019. Keep in mind, members, that last year, our HHS budget that passed the state of Minnesota and signed by the governor increased spending over 20%. Think about that, members. Over 20% in 1 year, and now this bill spends another almost $3 billion, part of it this year, more in the future, to grow HHS. Now, why should that concern you? Well, number one, people's incomes, the majority, are not going up at that rate. Number two, if you don't want to believe me, believe Tom Gillespie, our former state demographer. A number of years ago, he came out with a report that said if we don't get our HHS budget and government health care in this state under control, at some point in the future, there will be no additional money for K-12, higher ed, or roads or bridges. So members, voting for this bill is actually going to hurt your constituents in those areas. You want to fund education? You want to fund roads and bridges? You want to fund higher ed? This bill is going to take away your ability to do that going forward. Again, 20% last year, which was the budget year of funding, which was way too high, and now you want to add another almost $3 billion to spending on this. Think of your constituents. Think of their educational needs, their transportation needs. Think you could even spend it on light rail, even though I'd oppose that. So members, the other thing we're doing, okay, is, and you can look at an analysis on Center for the American Experiment, we're driving out with our high taxes and welfare system the successful in our state, along with their state taxes. They're moving to non-tax states, state tax states, and we're drawing in the dependent. That's a bad formula going forward. Now, I have a delegate this year who came to me. He happened to be from Hutchinson. He owns some rental property in Hutchinson. And again, we know that rental property is tight, especially, and housing, especially in the rural area. Do you know what he told me? He has people coming up here from Chicago and Detroit to rent his properties. And they are offering him $200 more a month than what he would charge a Minnesotan. And under that plan, that Section 8, they're keeping the difference, which he said on average, they're coming up here with about $1,800. That's the scenario we're producing here. Members, we need to fund the needs, but we're funding wants and desires. We're driving out the successful, and we're drawing in the dependent, which create less tax revenue going forward. Now, members, we have a historic budget surplus, but you have to understand a lot of that is the federal money going through the system. That federal money is one-time money. That's going to be gone. And when you increase HHS and some of these other areas by billions of dollars, you know what you're setting us up for. A big deficit. And you add to that, the Federal Reserve wants to raise interest rates about 7 times they've said this year and 4 times next year. That's an 11-time interest rate hike. You know what that's going to do to our economy and the market? You're going to see reduced state tax revenue when we're going that direction to try to control inflation. The other thing you need to understand, Bloomberg, it's a financial services, one of the largest out in New York, recently came out with analysis. They said inflation is increasing families' cost to the tune of $5,000 per year. So inflation is taxation without legislation. That's what you're doing. Now, you don't have to take my word for it. Milton Friedman, a former Nobel Prize winning economist, made that statement. So inflation is a taxation without legislation. And according to Bloomberg, you've raised taxes this past year over $5,000 per family. You know what that does? With higher health care costs, higher gas, higher food, you know what that does for the average low-income, poor, or fixed-income people? You're making them make choices on needs, members, not wants and desires. And you're taking us down the wrong path because you cannot control your spending. You have to take a look at need, want, and desire. I'll support needs, especially disability waiver, okay? But we've got to get rid of the wants and desires. And then you're taking us down a path of single payer and public option with the provisions that are in this bill. Members, I sent, just a minute. Okay, I sent you an email of an article from the state of Washington. They actually passed a public option. In that article, if you read it, and I'm only going to read 1 or 2 lines, here's what it said. So it's already in force in the state of Washington. Other states are looking at it. It says the public option relies on cutting payments to hospitals to control cost and ties reimbursement to Medicare rates, which don't cover hospital costs of providing care. And Medicaid rates, which is what we're talking about, are even worse than Medicare rates. You're going to damage healthcare access in your desire to give people healthcare in this bill. You're actually going to give them less healthcare access and less healthcare treatment. Secondly, it goes on, it says, if patients opt to join a public option plan rather than private insurance, over time, it could create financial challenges, especially for small rural providers operating on thin margins. So members, you're taking us in a direction to damage and close rural hospitals and less access. You know, they'll have a card that gives them health care, but they're not going to have access. And I think last session I talked to a Medicaid provider, dentist, right here in St. Paul. He lived just across the river. He happened to be selling a piece of equipment, exercise equipment, that I wanted for my wife because she had a knee replacement. And you know what he told me? He said he had 3 sons who had entered the dental business, or a dental profession. All 3 of them left the state of Minnesota. And guess what he told me? He was leaving the state of Minnesota because of the regulations and the mandates that we pass here in the House. Now, do you think low income and poor people are going to have more access to dental care when we have dentists who accept Medicaid, not all of them do, leave the state, whose children leave the state because they don't want to practice here in the state of Minnesota? That's what you're doing with this bill. 800 and some pages of the wrong direction in most cases. There's a few things in there that I could support, but 90% of it is taking us in the wrong direction. And I do want to respond to the pharma comments. Do I think prescription drugs are too high in some cases? Yes, I do, okay? I've sold health insurance in 1978. I have people crying about not being able to afford prescription drugs, okay? Seniors in some cases and people under 65. However, this bill, according to NFIB, is going to create higher cost, not lower cost. And NFIB represents thousands of small businesses, and it's going to be harder for them to provide health care for their employees. Secondly, the pharmacy board. You know, we got provisions in here that want to, if you introduce a drug into the state, you can't get out. Or the AG is going to get after you and sue you. You know what that's going to create, members? They're not going to introduce new innovative treatments to the people of Minnesota. They're going to have to go to a different state to get a prescription that will actually help them. That's what you're doing. This board is not going to solve the problem. It's going to hinder people getting the access to the new prescriptions that they actually need. We need a solution, okay? Most of it has to be done at the federal level, unfortunately. There's only minimal things we can do here locally. And this bill takes us in the wrong direction, higher cost and less access to innovative treatment. You're going to have more successful Minnesotans leaving this state to get the treatment that they need. So members, think of the increases in here, the direction it's going, and how it's going to impair education, transportation, and higher ed, amongst other things. It's going to become the largest budget in our state and growing. Think of what you're voting for here today. Again, there's a few needs in here that I could support, but a lot of this bill, I'd say close to 800 pages, needs to be removed. We funded HHS last session. We don't need another almost $3 billion increase, regardless of the intentions behind it. Please, members, come to your senses. People are having tax increases based on inflation. You're not helping them, regardless of your intention, and I'm not questioning your intention. You're hurting them because you're taking us down a road of socialism. So please, members, vote red. Thank you.
The member from Traverse, Representative Backer.
Madam Speaker, members, thank you. Just a couple of things here. First of all, I do want to thank the chair for the time that her and I spent talking about ambulance and EMS issues. Couple concerns that I have with this bill. First of all, we did have an auditor's report coming out about the EMSRB board, and if you've not went through that report, that's not a very good report. We have a lot of work to do. I'm a big believer, and I know others are, that we are here as a state to provide care for folks, and we're not on cardiac arrest with our ambulance services in Minnesota, but we're going to get there pretty close. Because folks like me, who's been served for 27 years, when you start getting in your mid-50s, when you get a call at 4 in the morning, the next day is a pretty hard day to just keep up. And as we know, those are very stressful runs, several of them. So that's the first concern that I have. We're just not doing enough for EMT and providers in there. This bill does help to pay for more gas for ambulance services, which we appreciate, but it does not address the long-term care rates. You know, like the service that I serve on, one of the reasons my wife and I in the service has to do fundraising every year is because most of our patients that we take are on a government program, Medicaid or Medicare. 70% of our runs, because we go, the area that I serve is a very elderly area. We go into Traverse County, Big Stone County, and then we go into Roberts County, South Dakota, and then we also service the tribe, Sisseton-Wahpeton tribe. So our service struggles, and we need to look at ways to help funding the providers. Also, you've heard me about workforce with volunteers already. Secondly, I'm really concerned about this bill with intermediate care facilities. I have a facility in Ortonville, Minnesota. Right now, they get $145 per person per day. I mean, that is difficult for them to run. They are the lowest in the state. And I know the Senate addresses that. Would love to see that come out of the conference committee, because these care facilities, like the one in Ortonville, Minnesota, are doing a wonderful job for these individuals. And that's something that we have to do. That's the compassion we need, and they need our support with the funding. So thank you, Madam Speaker, members, and I will be voting red. Thank you.
The member from Dakota, Representative Hewitt.
Thank you, Madam Speaker, and I want to thank you, and I want to thank the chair. This has been a great, interesting experience for me on the as a vice chair of this committee, and I want to thank the support I got on both sides of the aisle, especially my Republican colleagues over there. Those were some of the earlier conversations we've had about how the committee will go, and most of them know where my passion was, and that was within the EMS system. EMS touches everybody in this room, and hopefully not too soon, because one day or another, this is your entry level into the healthcare system, and it's unfortunate. And like Representative Backer just talked about, there's not a lot we can do about Medicare and Medicaid. However, Minnesota, because of our provider tax, does reimburse more to the ambulance services, and that's unique, and that did make a big difference in how we operate. But Representative Backer's also right about another thing. The MSRB was, I cannot say it any other way, but like while London slept by John Kennedy, we were sleeping. Our own vice chair, after hearing the report, asked for the immediate resignation of the board. Pretty serious, folks. Regardless who comes back next year, we need to fix this problem because it touches all of you. Some of you right now in your districts in rural Minnesota are waiting 60 minutes for an ambulance. That's unacceptable. We need to fix this. We need to fix it together. And it's not just money that has to be thrown at it. This board embarrassed us, and we have to get involved. And I got to thank Chair Liebling for her work on this. As Representative Backer said, yes, we got you more money for gas, and we got the wheelchair people more money for their transports, which hasn't happened in years. But what also happened is we were able to back off some regulations that's going to allow services like Representative Backer's service to use non-EMTs, such as police officers and firefighters, to drive the ambulance, which is much needed because we don't have enough licensed EMTs. It's also going to allow the MSRB currently to look at licensing and help people get there even if their license has expired. And those are important things to keep the system moving till we can look at the MSRB and move it forward. So I encourage you to vote for this bill because it does a number of things that are important to keep EMS going in Minnesota until we can come back and really dissect it out and do the right thing. I think if we would have done changes this year, and there were some proposed, one of the most important things they always told us when we were in training to be EMTs, don't make emotional decisions. We were totally emotionally charged by this report. So members, I ask for your help. I ask for a green vote today. Thank you.
The member from Nicollet, Representative Ackland.
Thank you, Madam Speaker. I just want to start with just making a comment. And I'm a first-year representative. I didn't know exactly what to expect when I came, but I did come hoping that there would be a lot, that I could make a difference, that we could do more bipartisan work, that we could work together. I've been super disappointed to see how that has only been a one-way street. I look at this bill. Inside of this omnibus, there are 245 bills or so. All of them are DFL. There are only 2 GOP authors in this bill. I'm frustrated. It's like I've tried in my committees. I've voted sometimes when my leads were like, Susie, what are you doing? And it's like, I think this is the right thing. It's not what my party did, but I tried to take a stand. And so as I look at this bill today, this omnibus bill, it's like, I don't see any bipartisanship in it. There might be a little piece here and a little piece there, but overall it's frustrating to me. And I see spending that, for instance, they want to expand the school-based home health, the school-based health clinics. I'm not saying I'm opposed to that, but as we talked to that in committee, I could see that maybe that's not the best use of our money right now. Our schools are crying for school nurses. Our schools are crying for mental health help. These home-based health clinics will help maybe a few schools, but I'm talking about the whole state of Minnesota. So that's $7 million that they want to use to expand that program. Again, I see the word expand a program. Right now, let's deal with the crisis we have. We have a workforce crisis. We have a nursing home crisis. We have a mental health crisis with our students. And we need more social workers in the schools. We need more school nurses in the school. And so I just feel like there could be a better way to use the money. And just to reiterate, working on the health committee has been, it's been a big challenge. As we can tell from the bill, there are lots of things to work on in health, and I'm looking forward to coming back next year. Hopefully that I can find more people who are willing to work together, and that when some of these bills actually come out of committee, they would truly have bipartisan support. Because I heard in my committees, oh, we've got good bipartisan support, and I was the only person in the Republican Party that had voted for it. So I don't call that good bipartisan support, but I am pleading with some of you who I think would be willing to work together to let's make a difference next year and bring these bills that really can pass with bipartisan support. Thank you.
The member from Hennepin, Representative Morrison.
Thank you, Madam Speaker. I rise in support of this bill and offer many thanks to the chairs and all of the members who put so much work into making this the great bill that it is. I want to briefly highlight the provisions that support maternal and child health. Helping our youngest Minnesotans get off to the best possible start has been a priority of all 5 of the health committees, and those values are reflected in this bill. Part of that effort includes a recognition of the unacceptable racial disparities that exist in Minnesota in maternal and infant mortality, and include efforts to eliminate those disparities. We know that when women are able to plan their pregnancies, they have healthier pregnancies. So ensuring that they have access to the kind of contraception that they want is key. We've made it hard for women to receive long-acting reversible contraception after delivering in a hospital. So the bill includes provisions to make LARCs available at a time that is convenient and comfortable and effective for them should they choose to use LARCs. The bill also includes a provision for universal voluntary home visiting during pregnancy and in the immediate postpartum period. This is a critical time to ensure healthy outcomes for pregnancies, babies, and families, and is a priority of the Black Maternal Health Caucus. Another important provision that I want to highlight is continuous medical assistance eligibility for children under 21. This provision makes kids eligible for 12 months of uninterrupted access to health care, which is obviously important to ensure they get the care they need so they can stay healthy and thrive, while also decreasing unnecessary bureaucracy for providers, patients, and families. This bill contains important provisions that will help support infants and families and addresses disparities so that all mothers, infants, and families in Minnesota can get off to the best possible start and have the opportunity to thrive. Thank you, Madam Speaker.
The member from Wright, Representative Lucero.
Thank you, Madam Speaker. And I want to touch on a few issues that we have not yet heard in any of the amendments or conversation thus far. And so in the course of some of the items I'm going to bring up here, I am likely to ask the chair to yield. So I'll just ask now if the chief author would yield for a question.
I forget who the chief author is. Representative Liebling or Representative Schultz?
Liebling, Madam Chair.
All right. Will you yield?
Yes.
She will. Representative Lucero.
Thank you, Madam Speaker, and thank you, Chair Liebling. That was just a preemptive request to yield, although I'm not asking you to yield yet. So, members, I would draw your attention to line 122. So here we have, actually, you know what? I will just start off right off the bat asking the question. So on line 122.11, we see a change of existing law from the word cancer surveillance to cancer reporting. So my question for the author is why the name change from surveillance to reporting?
Representative Liebling.
Thank you, Madam Speaker. I think that Representative Morrison actually carried this bill, and so she might be able to answer that better than I could.
Representative Lucero.
Thank you. If Representative Morrison would yield.
Representative Morrison, will you yield to a question?
Yes, Madam Speaker.
She will. Representative Morrison.
Thank you, Madam Speaker. And Representative Lucero, this bill brings Minnesota into compliance with the Minnesota Cancer Reporting System, brings our system into compliance with CDC requirements. And so that just reflects that. So this enables our outstanding world-class medical institutions and the University of Minnesota and the Mayo Clinic to receive federal money for research so that they can best do the job of research, treatment, and prevention of cancer.
Representative Lucero.
Thank you, Madam Speaker. I did not hear a direct answer to my question there, but I won't re-ask it. So we absolutely, I think everybody in this body agrees, cancer research, cancer treatment is absolutely important, very much important. But I would also hope, Madam Speaker, and I don't have to hope because I know that data sharing and consent from those whose data it is also very important. That's a bipartisan issue. But unfortunately, the language before us, the bill before us, is eroding that. It's taken us further away from the recognition that we are the owners of our own information. And we are the ones that should control where that information is shared with. So if we look here, we see, starting on line 122.16, an officer or employee of the Commissioner of Health may interview patients named in any such report or relatives of any such patient only after the consent So that's current law. The consent, that's being stricken, as you can see, and it's being replaced with notifying. So no longer are we going to need affirmative consent, but instead just simple notification to the attending physician, advanced practice registered nurse, or surgeon. And then you can see at the end of the line there, is obtained, is also scratched out. So we're no longer going to require affirmative consent. So what's going to happen with this information? So now information is going to be shared. And as you can see on 122.21, information containing personal identifiers. So PII is going to be shared. It's not de-identified data. It's identified data. Will be shared statewide cancer registry of other states. So we're taking Minnesotans' personal identifiable information, and we're eliminating the need to get affirmative consent before we share it with others, including other states. Is that a concern, Madam Speaker? Members, it should be. In fact, just last week we had a bill on student data privacy affirming the truth that students' data should not be shared, should not be collected, transferred, data mined without the affirmative consent of parents, right? Well, why do we not hold the same then when it comes to medical patients? Why are we going the opposite direction? It goes on to say, provided that other states agree to maintain the classification. Members, that is comfort language that means nothing. Nothing. Because classification has nothing to do with protection. The means, method, and effort in Minnesota that we put into protecting information may not be the same that other states do. And so we're going to be sharing information with systems that are not Minnesotans and without their consent. I'll move on. This is on line, or page 47. I draw your attention to 47.7. The commissioner shall establish a population-based surveillance system. Now, members, I'll stop right there. I just read in the previous section how we were changing the name, or the word, I should say, surveillance to reporting, right? Surveillance may have some connotations to it, so maybe it sounds less spooky, less scary if we use the word reporting. Well, members, here in this language, we're calling it surveillance system. Madam Speaker and members, should we be concerned with government engaged in the activities of surveillance? Should we? Absolutely we should. But why in a different section of the bill are we trying to make it sound less scary, less spooky, less civil rights infringing by changing surveillance to reporting, but here we're just going to call it surveillance? I say we just call it surveillance altogether, right? Because that's what it is. Government surveilling the population, collecting information. So I'll go on. Establish a population-based surveillance system. The purposes of these assessments, studies, and surveillance system are to monitor trends in incidence, prevalence, mortality, care management, healthcare outcomes, quality of life, and it goes on. So members, who is the government, or in this case, the Commissioner of Health specifically, to determine what the quality of life of any one of us is? Who determines what that is? Let alone the other aspects in this. Moving down to line 20, partnerships. Here we're going to have this information that's collected in this surveillance system is now going to be shared. Look at on line 20. The Commissioner of Health shall, in consultation with healthcare professionals, the Department of Human Services, local public health organizations, health insurers, employers, schools, long COVID survivors, and what? Oh, here's that notorious word, or two words, community organizations. So now we've got a government surveillance program that's going to, among other things, share information in partnership with community organizations. What are community organizations? What's that criteria? What are their protections? What kind of information is transferred to them? What are they going to do with it? Should we be concerned about that? I'll move on. This one is from page 49, starting at the bottom of page 49. The Commissioner of Health shall award grants to eligible individuals and entities to establish voluntary home visiting services to families expecting or caring for infant, including families adopting an infant. How does the Commissioner of Health, how is that person going to know or have knowledge of families expecting an infant? Members, unfortunately, the Lord has not opened up the door for us to become parents. But many in here have had the incredible blessing of being a parent. So members, when your spouse were pregnant, did the government know? How? Award grants to eligible individuals to families expecting or caring for an infant. Expecting. I guess that gets back to the surveillance program here in the other section of the bill. Continuing on in this section, the grant money awarded under this section must be used to establish home visiting services that provide a range of 1 to 6 visits that occur, and it goes on. So we're going to have home visits. So in order for home visits to occur, there has to be knowledge that you're pregnant, and then you're going to get a knock on the door. I heard you're pregnant. Can I visit your home? Can I come inside and ask you a few questions? Do you think that would be alarming if you got that door knock? You know what I would ask if that happened? Are you an agent of the government? If so, let me see your warrant before you come through this threshold. I'm reading portions of the language here. Include an assessment of the physical, social, and emotional factors affecting the family, and referrals to address each family's identified needs. Who is the government to determine what my needs are? So let's say the Lord does open up that door. My wife becomes pregnant. Hi, I'm from the government. Can I come in and do a home study? I heard your wife's pregnant. We want to study, we want to collect information on your physical, social, and emotional factors affecting your family. Wow, members. This is not the kind of stuff that we should be engaged in or spending taxpayer money on. And then after that information is collected, referrals. Referrals to who? You've just collected, you're coming to my house, you're going to collect information on me and my family, and then you're going to refer what to who? And am I going to get another knock on the door from some community organization? Members, this should be very concerning to us. Expanding home visits will increase government surveillance. Data will be collected on families likely without informed consent. Data will be collected on parents and children. Expansion of government into the homes of Minnesotans. That's the problem here. Members, I know that when I use the word chilling effect and civil liberties, a number of you on that side of the aisle, your radars go up because you do not want government collecting information and infringing on the civil liberties of individuals. But that's what this bill is doing, and I have huge concerns over it. Even if it weren't for all the other reasons to vote no on this bill, we in this body should not act like we're schizophrenic when we have the bill passed last week to increase protections on student data privacy, but then a few days pass by and now we want to erode protections on data privacy. Let's not be schizophrenic, members. Let's vote red on this bill. Thank you.
I recognize the member from Stearns, Representative Damuth.
Thank you, Mr. Speaker. Members, it has been an interesting day today as we've worked and tried to come up with some solutions and moving the state forward. But I would like to give a couple of thank yous to both Chairs Liebling and Chair Pinto. It is my honor to serve on the committees, and I've learned much from you, and I think, like I said last week, there are things we agree on, there are things that we see differently, and then there are definitely some things that we disagree on too. And then also to Leads Schumacher and Lead Franson, thank you for your leadership on both of the committees. It is my honor to serve along with you. And then to House staff, they are faithful and wise. And then also to our researchers on our side of the aisle, Jeremiah Wingstead, Jody Withers, thank you for the input that you give and the assistance. But while we're looking at this bill, members, I am going to be a no on this bill today. I see this bill as driving up the cost of health care through unnecessary regulations on behalf, or regulations on our healthcare providers. And the sections of the bill that create the hospital staffing committee will lead to mandated staffing ratios. Those provisions make it impossible for hospitals to adjust staffing based on the need and nurse experience. This mandate will lead to patients potentially backing up in emergency rooms, just in avoidance of the facility running afoul of the staffing ratios. Additionally, this bill creates an unelected board that can set spending limits for facilities. Facilities that fail to meet those limits could be charged $500,000. So that is not a way to lower health care through fines and taxes. And as I tried to bring up a couple of my amendments this afternoon, one of them to provide licensing and inspections would have kept women safer. And that was not even able to come up for a vote. So that was quite disappointing. But I'd like to turn your attention to the early childhood provisions in the bill. We know that our family child care providers do need to be part of that bedrock of the foundation of any real long-term child care solution. However, the provisions in this bill, the education bill that we heard last week, and the actions taken by the Walz administration continue to undermine the value of our family child care providers and risk forcing more of those providers out of business. A school-connected child care system is not a realistic system. Parents actually need child care throughout the year, not just when schools are open. Child care providers cannot be expected to operate under the regulatory thumb of both the Minnesota Department of Human Services and the Minnesota Department of Education, while also hoping to be included and in coordination on the plans developed by their local school districts. Throughout this process, we have seen proposals and actions that seriously question whether this administration wants all family child care providers at the table. Last year, during our first special session, we passed a provision to establish a new ombudsperson for family child care to provide that critical support and give all providers a voice. House File 33 was passed by this body on June 26, 2021, and signed into law by Governor Walz on June 29th. After 4 months, the ombudsperson position was finally posted on October 23rd to seek applications, and it closed on November 12th, resulting in 28 applications. In the following 4 months, these 28 applications were screened down to 16 individuals meeting the minimum requirements and qualifications, from which 5 were selected for a screening interview, producing 3 candidates for final consideration. At the end of March 2022, the governor made an appointment for the first family child care ombudsperson. So in case you missed that, it took the administration 4 months to write a 2-page document, most of which was already written in Chapter 7 from our 2021 first special session. In the Early Childhood Committee, I suggested that the 8-month process to name a family child care ombudsperson signaled that maybe the administration was not taking our family-based providers seriously. Some members took issue with that characterization, yet I am forced to wonder how it is possible that it did take the administration 4 months to write a 2-page document for posting the position. The governor is ultimately responsible for knowing what is included in the bills that he's signing. However, I had a member of the administration admit that they didn't realize the ombudsperson position made it into the final bill that was signed by the governor. Members, just so we're clear, this was not some obscure position that was slipped into a conference committee in the dark of night. The provision had been previously advocated by Rep. Franson. This provision had been included in the recommendations from the Family Child Care Task Force, which I had the privilege of serving on and was co-chaired by Representative Wasilwick. This provision was introduced by me last session, and the provision was also included in Chair Pinto's Early Childhood Committee ombudsperson last session. So if the administration was seriously concerned about the family child care sector, they would have been tracking those recommendations of the Family Child Care Provider Task Force and would have been ready to begin work on day one. Therefore, I think that any criticism of the administration at this point is not partisan, but it may be warranted. Members, I also want to talk about the child care stabilization grants that are included in the bill. This bill proposes to continue what was temporary, the temporary emergency, federally funded child care-based grants. This funding is determined by the number of adults employed rather than the funding based on the number of children or families served. In the current budget agreement, federal funds were dedicated to help stabilize child care programs in direct support for the employees, regardless of how many children were being served. This temporary agreement is now made permanent by this bill. First, if there is to be a connection between child care programs and public schools, we should keep in mind that we fund schools based on the number of children enrolled. We don't fund schools based on the number of staff employed. Second, these base grants are specifically designed to benefit child care centers with a large number of employees rather than benefiting all providers. When this inequity was noted in committee, the argument was made that paying providers based on their full-time equivalent, or FTEs, was fair. However, child care centers and family child care providers are different program models where traditional FTE calculations don't apply. A child care center with accounting or human resources support are better able to itemize their FTE count to maximize their state grant revenue. But family child care providers are often sole proprietors, providing a service in their own home working without other employees, and working far more than just a full-time equivalent day. So as we put this together, as I mentioned before, my concern is that the provisions of this bill, along with the pre-kindergarten plan in the education bill, would lead to further erosion of our family child care providers. I'm also very concerned about comments made last week during consideration of the education omnibus bill in creating a connection between child care and the public school system. Parents should not have their child care options limited by their zip code or the residential school boundaries. As our schools have become adult-centered systems that happen to serve children, that is not a successful model or desirable substitute for a robust array of child care provider options. The constant conflict in the Early Childhood Committee is the dual purpose of child care. It is either a system for providing an education for our littlest learners or a system to watch children so parents can go to work. Therefore, we either build a system for children or a system for adults, but it is very hard to make that both. We've heard a lot about childcare being critical to meeting the labor needs of our job creators and critical to the participation of women in the workforce. So I would remind you that during a joint hearing of the Early Childhood and Workforce Development Committees, we specifically heard from our job creators that our early learning scholarships were a proven model of success. The business community was very clear in the model that they preferred, and that was the early learning scholarships for a wide range of children, not just scholarships limited to infants and toddlers. The scholarship program is evidence-based, parent empowering, and flexible for our families and our providers. Schools, public and non-public, Head Start, child care centers, and family child care providers can all benefit in the service of children and families through a robust scholarship program. And instead of the government picking winners and losers, we leave those economic decisions to the parents and families where they belong. Scholarships are the definition of a win-win, both child-centered and parent-focused. The prospect is relatively simple. Give parents the purchasing power to fund providers to meet the needs of children, families, and our economy. We can either fund families to choose their providers, or we can fund programs to choose their families. I would put the parents and their children first in that equation. So members, I will not be supporting the bill today. Thank you, Mr. Speaker.
I recognize the member from Candy, Ojai, Representative Baker.
So there's things in this bill that are missing, and there's things in the bill that I am shocked to see here, and I want to just talk about a few of those things. Again, I've always appreciated the bipartisan work that Chair Fisher's committee had. I didn't realize there wasn't a very open pipeline going up to the finance committees, because there's so much in this bill that is missing that it's embarrassing. I'll just remind everybody, we still are under a real substance use disorder issue in the state of Minnesota, in the country. There's still an opioid crisis going on. We talked about fentanyl last week. You laughed at me for thinking we should treat fentanyl like it's cocaine or heroin. You voted that down with an amendment. We did an attempt on that, but there's something missing between the folks that are running the House floor and what goes on a bill and what doesn't, because there's some really good stuff that didn't make the bill cut that doesn't even require much money at all, because spending is not a priority, so you can't blame something here because it was too expensive. Now that's laughable. But what you're missing on this bill, folks, is something that I really give a lot of credit to Representative Frederick on, and he worked really hard on a bill that we kind of named the March bill. Now, if you're not in the behavioral health, if you're not in HHS, I understand those acronyms are hard to understand. MARCH is something that stands for the Minnesota Association of Resources for Recovery and Chemical Health. They are an association of a lot of providers in the state of Minnesota. They work really hard on good policy. They are a collaboration around the state of Minnesota that gets us to pay attention to what do you have to do to help make our patients better and more healthy and a better chance of recovery. I have a lot of respect for MARCH and what they've done. One of the things we worked on was the expansion for an option for guest speakers. So when you're in treatment, whether it's outpatient or inpatient, providers get paid a billing payment if you have some speakers come in, which is an important part. They want to hear different voices from different people about their lived experience. But they don't get paid on guest speakers unless you have a qualified professional with certain credentials who is an expert in the area, and you have to have these credentialed experiences. And there's a fine line there. I get asked to speak to support groups a lot because of my journey with understanding my addiction through my son. And if I came in and gave counselors information and the folks, the men or women sitting around the circle about what I can share with them, that's not a billable thing, but it would be if somebody was in my case that happened to be a certified licensed and alcohol treatment counselor. There's a difference there, and there shouldn't be. This is a really simple one that should have been included on here. It gives their counselors a lot more tools, a lot more people can come and do this, and it's only fair that should have been added. It's in the Senate bill, as far as I know. That's coming over. Current providing on training on HIV for treatment staff. This is the next item I think should have been in the bill. Current training on HIV for treatment staff. So currently, providers are required to use an outdated 31-page document to train staff on HIV. Providers have been told they cannot modify this document for any training purposes and must use the full document, including the outdated link. We try to change that, make it simple. It's really simple stuff here. We ask the change in this section is the commissioner can outline the topic section so providers can develop their own HIV training with staff with accurate and current information. Nothing that we're talking about here either was opposed by DHS. They thought it was very workable. Again, I give credit to my colleague, Representative Frederick. He reached across the aisle. Chair Fisher allowed us to go back and forth on this bill to get it better. I think we either tabled the bill or we hung on to it so Representative Frankie and I could meet with Representative Frederick on this because we wanted to get this bill right. Another one that's not here is flexibility in residential treatment hours and co-occurring credentialing staff. Providers with a co-occurring enhanced license are required to have 25% of their clinical team be fully licensed professionals, and there is a limit on the number of interns, pre-licensed staff the agency can engage in. This creates an undue burden on providers due to the workforce shortage today. The current ratio punishes institutions who are a learning institution and those agencies who are developing mental health practitioners. We had a recommendation supported by DHS. These sections, we could provide means of programming to determine the adequate staffing complement for co-occurring needs as long as the basic requirements are met. There was some simple language. We could have really done some good stuff with this too. There's other stuff, I think, maybe one more. This one is extending the completion of documentations when there's a significant event. So if you're in treatment and something happens in the treatment center, in outpatient, when there's an event that happens, maybe a couple folks get into a big argument, maybe there's a confrontation, maybe there's an event that needs to be written down. Currently, That event happens, the drug counselor has to stop and immediately go and document that thing right now, right now. It's immediate. That's what the law says. But we brought an idea that says let's let them have this proposal and seek out the license holder to document this within a 24-hour period. It's really a challenge when something like this happens at the end of a day and the counselor is ready to go home. It's been a long day, it's a stressful day, and now he's got to stop and he's got to take an hour or whatever it takes to document that. But we gave him a tool that he could have done it the next morning. Can't do that. That was not in the bill. But here's what's in the bill that I find a little ironic. From the governor's office, he wants to expand the ORAC Council. Now, ORAC stands for the Opioid Epidemic Response Advisory Council. 19 members sit on that statewide opioid board. I happen to be the current chair. I'm honored to serve as the chair. We're doing a lot of amazing things with ORAC. You'll hear ORAC a lot because we are going to be helping a lot with distributing the lawsuit dollars coming into Minnesota to local communities. And I am going to make sure as the chair that we do this right. And as those 19 members are hand-picked or carefully selected from the seats from the legislature that passed a couple years ago, those 19 members all have a reason to be there. And it was painful to get the members right. The seats for the indigenous community, the folks in communities of color, people in recovery, physicians that specialize in addiction, all those seats have been carefully thought of. On this floor, Representative Cagle and I represent that ORAC Council. But from the governor's office, and now part of your bill, but not this other stuff that I mentioned that's not in the bill, the governor just wants to add 11 new members to the council. Just let's put 11 new people on the council of 19. So let's increase it by 57%. He wants 9 tribal seats added to it, just all tribal. We have 2 already, but he wants all of them on there. And he wants 2 other members who are representing urban Indian populations. So 11 new seats total. Now, this came up a year ago, and we asked ORAC, the folks on the council, hey, what do you guys think about this? And the members of ORAC said, no, thank you, we don't need this. But it keeps coming up. The governor wants to have his say on that, but the ORAC folks who are doing this every day, working hard on this every day, the governor still wants it, so it's in the bill. Now that takes our council from 19 to 40. You can't manage it. It's not as easy to do that. And folks, we're doing a lot of good things there, and this is in the bill, though. Another thing that's in the bill from the governor's office, and it's in your bill now, this proposal would increase or require 40% of our granting dollars that we do probably twice a year. So the granting ability that we can do with ORAC, which goes to local communities, it goes to Indian tribal nations for healing purposes, and we are spot on, marking where we need to spend the money the most. Communities of color, we try to hit all the corners of the state. The governor wants at least 40% minimum, always and forever. 40% have to go to communities of color, period. Well, checked my last bit of, granting that we did last time. It was 42% that went there. So, Governor, we already got it. But there can never be an exception in his rule, and now your bill says, ORAC, we think this is better because you know what's in front of you with grants. We look at all the scoring, we look at all the communities that need it, and you don't trust that we can make the right decision. Well, we're proving to you that we do it already. So don't give us more of this when we're already doing it, but this made your bill, but the other stuff did not make the bill. Sad. And then finally, the opioid treatment providers met with DHS, met with folks that said this new expanded rates that you want to blow up and change a little bit, they've been clearly telling you this is a 30% or more reduction in reimbursing opioid treatment providers. Folks, we're in an epidemic. Why would you even think about putting these forward when the providers have said, this is going to hurt us? DHS is saying this is neutral. They're wrong. They're wrong on this. Ask the providers that do this every single day. So this is in the bill, should not be in the bill. We've all gotten emails from our local folks to say, what are we doing with this? This is not the thing to do at all. This will literally close. We have about 16 opioid treatment providers in Minnesota that specialize in this, and this will absolutely close a large majority of them. 30% reduction right now when we're dealing with opioids, fentanyl. It's really bad. So this is what's sad about this, again, is when Representative Frankie and I were on the Behavioral Health Committee, we just knew we wanted to do something that was going to make a difference. And when we first heard this March bill, even before session started, and we had Representative Frederick working on this bill, and he would call us. We met almost weekly for 3-4 weeks to make sure that we had the right stakeholders there and talking about this. And we really thought when it left Chair Fisher's committee on upwards, it had a really good chance of seeing the light of day. And I don't know what happened. I don't know what happened, which chair killed it, but it was a great bill. Thank you, Representative Frederick, for working your tail off for the folks in recovery, for the folks that are trying to provide a really good pathway to recovery. Thank you so much. And I'm committing myself with you, Representative Frederick, for future work on this because you understand it, along with Representative Frankie and a few others. But I don't know why leadership on that side decided it's not important enough to be part of the bill. It was simple, very low cost on many avenues, but I'll bet you there's a bunch of this coming over from the Senate. I will bet you there is. And now the House position is lousy when it comes to treatment. Shame on this body for not making this more of a priority for people that need help, for people that want to have lawmakers listening to them. And let's listen to the providers that do this every single day. They know what's going on. It is a complicated recovery process, and it's different for so many people. Some might be religious or spiritual. Some might use medically assisted treatments. Some can do the abstinent, and some are things in between. It's different for everybody. And we have to do a better job in this body listening to this. Golly, I wished I could have supported this bill with big components like this. I'd love to be on the conference committee to get this kind of stuff back into it. So we'll have to carry on, but we need to come back with a conference bill that has something that will actually help these folks. But this bill fell way short. And members, this is a sad day for people trying to get through this horrible world of substance use disorder. It is a disease, and I hope you take it serious someday.
I recognize the member from Ramsey, Representative Wasilewicz.
Thank you, Mr. Speaker. I'm rising today to speak in support of this bill, which makes significant investments in early care and learning. We know that a lack of childcare hurts families, businesses, and communities, and as Representative Demuth mentioned, is one reason why women are struggling to re-enter the workforce. This bill provides funding to help stabilize the childcare industry, make childcare more affordable for families, recruit and retain early care and learning staff, and continue the good work that we started with the Family Child Care Task Force. I do want to briefly talk about some points that were made earlier by other members that are not quite accurate. One is about the home visiting program. As noted in the language, it is a voluntary home visiting program. These programs exist right now, and they are very effective and very impactful, and they're actually a best practice that is recommended by the folks who work in this area. I actually had the opportunity to attend a home visit with a nurse and a mom and her two little ones, infant and toddler. And the mom that I got to visit with was concerned about her infant had a cold, and she was concerned about symptoms and what it meant and how she could take better care of our infant when the infant was sick. And the little toddler was running around playing with his toys. And it was a great time to see what home visiting actually does and the conversations that these folks have and the care and support they provide to families and parents. And I would encourage members, Representative Lucero mentioned home visiting, he's not on the floor, but Representative Lucero to do a home visit, to go with a nurse and do one of these home visits, I would recommend it for all members. It's a really great program, and the folks who work in the program are very knowledgeable and very supportive, and it's a really impactful program that is really important piece of what we're doing to support families in our state. I also just wanted to address a few things that Representative Dameth brought up. So I'm the former, as she mentioned, I'm a former co-chair of the task force, and I just wanted to highlight actually in this bill, there were, let's see, the One-Stop Child Care Regional Assistance Network was a family child care task force provision that was actually in the governor's proposal. The governor actually wanted to put more funding into that. There's also shared services grants, which was a family child care task force recommendation. That was in the governor's proposal to put more funding into that. There's also the child care provider access to technology grants. That is to help child care providers get better internet access, which largely impacts folks in greater Minnesota and family child care providers. That was a governor's proposal. So to say that the governor, the administration doesn't support family child care providers, it's just not true. I also just want to point out that we actually increased funding for early learning scholarships in our education bill, $180 million increase, and Republicans voted against it. So I think we can highlight where the funding is, where it's going, who's pushing it, but it's really important to understand that this was a group effort. This was the governor and the House DFL, and there's a Representative Dameth piece in here as well, to come together and say, we recognize the importance of early care and learning, and we want to put further investment into this so that not only we're helping the kids and the families, but that we're really doing our best to support the providers who provide this care, and they're the workforce behind the workforce, and I'm glad to see significant investments in this bill to support them. Thank you, Mr. Speaker.
I recognize the member from Olmsted, the member from Otter Tail, Representative Rasmussen.
Thank you, Mr. Speaker. One of the biggest concerns that I hear about from my constituents in Otter Tail County is the rising cost of living. And so it's unfortunate to see the missed opportunity in this bill and to see other policy in this bill that will actually drive up the costs of health insurance and health care for all Minnesotans. We also see a continuation of the DFL belief that government knows best. And the first examples of that is looking at how this bill takes away tools that health insurance companies can use to help reduce and manage the costs of care. One example of this is that the bill would freeze drug formularies. So when a drug manufacturer, when Big Pharma increases prices, the insurers will no longer have this tool or will have to wait to swap out expensive drugs for less expensive options on the market. Additionally, this bill prohibits white bagging, which is a tool that insurers use to reduce costs on expensive specialty drugs, and studies have shown that white bagging has led to lower costs for patients without sacrificing quality of care. Another aspect of the bill that I hope there's bipartisan disappointment in is that there was a number of new health insurance mandates that did not go through our bipartisan health insurance mandate review process that was created last session with bipartisan support in this legislature. So we're going to be voting on a bill that we don't know the cost of these mandates and how it will increase health insurance premiums for Minnesotans. So it's disappointing to see that the DFL in their bill here today is not concerned with increasing costs of health care. We even gave the House majority an opportunity to take our nearly $10 billion surplus and return some of that money to taxpayers by lowering the tax on MNsure premiums and eliminating the sick tax, which would put more money in Minnesotans' pockets and help them afford health care here in our state. So I would urge members to vote no on the bill. This bill will increase the cost of health insurance for Minnesotans. It also misses opportunities to reduce taxes on health insurance and is just going to be adding more fuel to the inflation fire that we see in our economy today. Thank you, Mr. Speaker.
I recognize the member from Anoka, Representative Scott.
Thank you, Mr. Speaker. And thank you, Representative Lucero. I guess he's not on the floor right now. I think he's back in the retiring room. But thank you for the questions that are concerning in this bill regarding patient consent and patient privacy. I do have one question for Representative Morrison, if she's available and would yield.
Representative Scott, who are you asking to yield?
Representative Morrison, if she would yield. I believe she's online.
Representative Morrison, will you yield to a question? It seems she's unavailable. Representative Scott.
All right. Well, I will just continue on with my comments, and hopefully someone maybe can text her and tell her that I do have a question about the research aspect of the Cancer Bill 4706. But members, there are several troubling aspects of this bill when it comes to patient privacy and patient consent. Some of you know that Minnesota is the only state that has the Minnesota Health Records Act, and that requires annual consent by any provider before treatment is done. And this bill flies in the face of all of that. On the cancer surveillance, the bill is actually taking away, there used to be a requirement for the physicians to consent for their patients to be in this database, but that even is taken away. And now our patients, our cancer patients, are going to be involuntarily have their identifiable information entered into this cancer nationwide database without their permission. That's very troubling. And there's no even way, there's nothing spoken of in this bill that says, well, you can let the patient know at least that they're going to be entered into it. There's nothing even in there that lets them know that they're going to be a product of research. So that's troubling. The bill on the long COVID tracking of patients, and again, there's no consent required. They just automatically take people who have, I guess, been diagnosed with long COVID and put them in a database, and they're partnering with other agencies, schools and other agencies. So all this data is going to go into a database at Minnesota Department of Health. We don't know what it's going to be used for, and how long it's going to be kept, who has access to it. And then the newborn screening. There's a broadening of the newborn screening program in this bill, and this has been a fight at the legislature for a long time. And what I think is finally in law is that you have to at least let the parents know that they can opt out. It's an opt-out, not an opt-in. Well, what this is doing is it's expanding. So families that elect to have their child at home or through some other means at some other location rather than a hospital are going to have this newborn screening done, or they're going to have people come to their homes and ask if they want this newborn screening to be done on their child without any information that says the Minnesota Department of Health keeps these blood spots of your infant forever, indefinitely, unless we as a legislature act and say, you have to get rid of these blood spots. They're doing it without consent of the parent. And the final piece that is alarming to me is these in-home visits. And it's the government coming into your home. And most people that have this happen to them are not going to know what their rights are, that they don't have to let somebody in, that they are not going to know that they're there to look at other things other than just a child. They're there to see what the psychiatry of your home is, what the psychology, how you are doing as a parent. Are you, in their minds, emotionally stable or not? It's a huge intrusion. And so, folks, I have real problems with this bill because of those issues and many others, but I think we need to do better at protecting patient privacy and getting patient consent. At least provide Tennyson warnings to people whose information is going to be used for research. It's one of the basics in the ethics of research is that the subject of that research should know and voluntarily enter into it. So I have huge concerns, and I would encourage a no vote. Thank you.
I recognize the member from Olmsted, Representative Quam.
Thank you, Mr. Speaker. To Representative Scott and Lucero, I asked on that data thing what they just want to have a way of making sure you don't have duplication of data. My suggestion is Minnesota offers we'll do it inside of our state and make sure you don't have any duplication in that study. We take privacy seriously for our citizens. But what I wanted to bring up is I keep a stack of audits in my desk here, because whenever we're doing something, we need to keep an idea of what has been done in the past and what suggestions to prevent issues and problems. There's no one in our nation that doesn't understand medical costs are going up and continuing to go up. And I think a real intelligent way is to prevent fraud and abuse so that the dollars that we have to spend go to people that need it. Over the years, we've had multiple occurrences of audits. And since I've been on the Legislative Audit Commission, there have been hundreds of millions of dollars of medical fraud that have been uncovered. And a lot of issues, and you'll get these nice little reports with, arrows on, and it says not adequate, generally not adequate, generally adequate, and adequate. Unfortunately, not adequate comes up too often on controls and also on complying with legal requirements and state policy. So it's not just the controls, it's compliance to what we do here and rule generation to make sure the people that need this, the money, the programs, the support, the help, get it. And we've all seen in the last 2 years, it's a lot of stories where billions and tens of billions of dollars nationally were wasted on fraud that could have helped out a lot of people. So every time we do a bill like we do here, and it's supplemental, so we're looking at what we did and how can we make it better. Making it better is doing our research and preventing bad actors from wasting money that are needed by our citizens. So I'm with the people saying, this stuff's expensive. It keeps going up. What are you doing? And we try to come up with stuff, but I think that we've fallen short of really putting in the checks and balances to make sure that this money goes to the people that need it. And anyone that wants to borrow any of these from me, be my guest. Thank you.
I recognize the member from Washington, Representative Frankie.
Thank you, Mr. Chair. Thank you, members. It's kind of hard being the lead on the Behavioral Health Committee when the person in the seat next to you is Representative Dave Baker. So a lot of what I'm about to say, Representative Baker has already gone through. I would like to start by thanking Representative Chair Fisher for his great partnership in this committee, and Vice Chair Frederick for his work. I'm also going to start by echoing a little bit of what Representative Baker said about the sad vote we had on bringing fentanyl up as far as the criminality of it, and how I see that this fits within the Behavioral Health Committee and community, because from what I see, we are not dealing with this properly. You know, in this committee, we heard what was given to us or what was passed down to us. And a lot of what I'm seeing in this current omnibus bill, we did not hear in committee. And things that we did hear, the good things, Representative Frederick's bill, and Dave and us, we refer to it as the March bill because that is the one main organization that we worked with. Maybe the way it's described, some of you will understand it better. Pathways to Recovery is the name of the bill. And when we are not investing in recovery and yet not willing to criminalize fentanyl to the same level as methamphetamine or cocaine, then where are we setting our priorities, members and Mr. Chair, when it comes to addiction? Because if we are not investing in the proper places, then all you are going to get is addicts and criminals. And that is not the proper place to go with this. And if we are not making the proper investments into the addicts, as I have seen, and I'll echo what Representative Baker said about Representative Frederick's bill. When I saw this, as a person in recovery myself, I honestly felt like this is something that could work. This is something that, and I know on our side, we don't like to make or spend money, and it spent some money, but I'll tell you what, it put it in the proper places to help those who are addicted, to help those on that path to recovery, because it gave them the tools necessary once you get out of treatment to have the ability to become successful. And when you have that ability to become successful and end that cycle, over time, members, that investment will pay us off tenfold. It will pay us off in healthcare. It will pay us off in savings and public safety. It will pay us off in education. It will pay us off by making somebody a more contributing member of society that is going to get a job, work, and pay taxes that we all like to spend up here. So to say that I'm disheartened and saddened that House File 3414 of Representative Frederick is not in this bill is minimalizing it. I see more provisions from the agency and Governor Walz in this bill than we actually heard in our Behavioral Health Committee. And that is very sad too, because as the lead on this committee, I would ask multiple times of the agency for information, or can you get me that? Or, you know, I'd like to see that. Well, sure, Representative Frankie, we'll get you that. Sure, Representative Frankie, you know, we'll get you that. There are some things I'm still waiting on, and here we are debating the omnibus bill. So I just think that moving forward, whoever's in charge next year, please, we need to take this area of addiction and recovery a lot more seriously. I can't echo enough the issues that we've seen in the past couple of years and what we're going to see going forward around the fentanyl issue. And that doesn't even include the methamphetamine or the cocaine or the things we're not willing to look at. But what I do see in here, members, is several provisions around marijuana. Now, I'm not against that. But where, again, are we putting our priorities? In the Behavioral Health Committee, do you know how many marijuana provisions we heard? 0. Now, I know that side doesn't want to admit, I've seen it over and over again, that marijuana isn't addictive. And it is not methamphetamine. No, it is not cocaine. No, it is not fentanyl. But once again, members, marijuana is a drug, and it is addictive. So, there again, please, if this committee moves forward, let's take it seriously. Let's take the provisions that we can actually agree on, work together on, bipartisan support. Chair Fisher, great committee. I think just about almost everything went out of there bipartisanly because we took the time to vet the bills that were given to us. But in my eyes, sometimes, a lot of the things we were not able to see because they were not given to us. So with that, members, thank you. Thank you to my team. Thank you to Chair Fisher and his team and Representative Frederick. I can't echo enough the work that Representative Frederick did on 3414 multiple times. And I've said it over and over again, and sometimes we get into this around here, members, where we're like, that person doesn't even know what they're talking about on their own bill. Are you kidding me? This kid did his work. Partisanship aside, I got to give it to Representative Frederick. This kid does his work. So with that, members, thank you for listening. Let's take this seriously, and let's vote this bill down, get it across to the Senate, and come up with something better. Thank you.
I recognize the member from Douglas, Representative Franson.
Thank you, Mr. Speaker and members. Members, first I want to follow up on the family child care omnibus person appointment. It is simply not credible, as my colleague, Representative Dameth, said. It's not credible that it took the administration 4 months to write a 2-page document that included a job description and qualifications already prescribed in law. So I agree with my colleague, Representative Dameth. I did it again. It's because Siri, when I call Representative Dameth, I say, please call Representative Dameth, and it comes back calling Representative DeMuth. So in my head, anyway, I digress. Siri is just awful sometimes. So anyway, I agree with Representative Dameth that there is more to the story. And unfortunately, it is not simply explained away by incompetence. After waiting or wasting 4 months to simply post the position for applications, which was only posted for 3 weeks, the administration then took another 4 months to screen 28 applications to finally arrive at the absolutely worst selection to be our first family child care omnibus person. At a time when we need to bring all providers to the table, the administration is clearly signaling only those invited are welcome to join. I shared with my concerns with Chair Pinto. And Chair Pinto, I thank you for listening to those concerns. Our conversation was respectful. I felt heard. I felt listened to. And I thank you for taking my message to the governor. However, I am very disappointed that Governor Walz has not taken this matter seriously. As I said, I don't think this administration is completely incompetent, so I can only presume that in selecting a person who led the politically motivated and failed effort to unionize our family child care providers to be the first omnibus person for all family child care providers, the message is unmistakable. This appointment makes clear the administration and the DFL intend to try again to unionize our family child care providers. And if the providers won't unionize, then the proposals offered by the DFL will drive them out of business. Either play ball child care providers or go under. That is the message in this bill. This position was originally brought forward in 2016 when I held the Child Care Task Force. That bill number was House File 3432. Never once in my wildest dreams did I think that that bill idea would be given to a political hack, one that attempted to unionize our small business providers. How many of you in this room were around during that debate? It was like a 12-hour debate on the unionization effort of child care providers. Unbelievable. I also want to touch base on the child care stabilization grants. This child care stabilization grants were started with one-time federal emergency funding to provide a temporary stopgap for providers hit hard by the governor's orders to shut down the economy. It was temporary. The bill proposes making this temporary emergency program a long-term general fund commitment under the full control of the Commissioner of Human Services with no statutory guardrails. Into perpetuity. This bill proposes making this temporary emergency program permanent, like I said, and it is unsustainable. This surrenders our legislative and fiscal authority to the executive branch, which they will then use to pick up and choose the child care providers they want to help. Winners and losers. Sorry, you don't qualify, family child care provider. Oh, this child care provider, absolutely you qualify. No, you don't. That's what this bill is, picking winners and losers. This, at the same time, you are about to empower the Department of Education to pick and choose which child care providers would share in the funding for their pre-kindergarten program. This irritates me, and I will tell you why. Because every one of us in this body gets messages from our district that says, what are you doing, Representative Albright, for child care providers? What are you doing, Representative Erickson, for child care providers? What are you doing, Representative Lilly, for child care providers? That is what we hear time and time and time again. What are you doing? This bill, you know what it does? It opens the path up for big government to continue swallowing the private sector. You cannot compete. The private sector cannot compete with government. Government always wins. And you're purposely driving these child care family providers out of business and ushering in these toddlers, these preschoolers, into the government program. It's absolutely disgusting. Finally, I want to talk about the Child Care Assistance Payments Programs, or CCAP. This bill doubles down on the CCAP program with the assumption that the fraud and the corruption issues that rocked this program before the pandemic are either long gone or at least forgotten. Sadly, that is likely not true. Now, we're dealing with food fraud issues under the USDA program. The pandemic has been a gold mine for fraud. As you know, with the Feeding Our Future scandal, or as I like to say, feeding our fraud. As we have seen the somewhat publicized federal nutrition reimbursement program involving up to $200 million in federal funds intended for feeding children. That money wasn't going for feeding children. They were taking that money and lining their own pockets. And unfortunately, there is a connection between this potentially massive fraud scheme and child care programs participating in the federal food programs. Something that I was questioning many, many times. If there is fraud in the CCAP program, there's probably fraud in the food program. Well, lo and behold, we found that true now. This bill makes a massive general fund commitment and leap of faith that program integrity will now follow the money. There is no denying our child care providers need help, and more importantly, that parents wanting child care need affordable access. For years, this access has been denied through excessive regulations and fraud that diverted limited resources from families in need and honest providers. The DFL solution, however, cannot be a one-size-fits-all child care system based on our system of public schools. The solution cannot be one where bureaucrats, rather than parents, are the decision makers when it comes to their children. Parents are in control of their children, not the government. And most importantly, the solution cannot be a system that continues to wipe out the family child care providers in favor of school-based or connected child care centers. I think I said that already. This bill is packed full of new spending and commitments that will force higher taxes or painful roadblocks and rollbacks down the road. For our friends and advocates seduced by the really big numbers in this bill, 876 pages that will force higher taxes, I will remind you that the devil is in the details. 876 pages worth. Our providers cannot afford buyer's remorse when they realize the system that they were sold did not include them. Next, I want to just highlight quickly the amendment, the 812 amendment that I brought forward earlier. Thank you to those who voted for it. I read a little tweet earlier that said, a Republican in the Minnesota House is equating vaccines to cigarettes. Imagine trusting these politicians with your reproductive health. Well, I'm not exactly sure what lawmaker said that because I didn't hear that. What I did hear, though, is myself speaking, and apparently this person didn't listen to my speech, where I quoted what President Biden said, which was, if you want the true quote, I could say that, but it's a little embarrassing because Biden mispronounced some words, which I did not mispronounce those words. I could have said the entire quote how he said, but his quote, with my interpretation, said, imagine had the tobacco industry been immune to being sued, okay? And then I said, remember the days, I don't, because I wasn't around then, but when cigarettes were once considered safe to use, and then I talked about the tobacco settlement of $6.5 billion because lo and behold, cigarettes were no longer safe, right? Leading up to the point of my amendment. But never, let a tweet get in the way of talking about reproductive health, I guess. And then I talked about the opioids, the Sackler family. Thank goodness that they were held liable, that Congress did not give them the sweet deal that the pharmaceutical companies have when it comes to vaccines, right? And then I mentioned a little bit about thalidomide, right? Remember that? Okay. How many of you know the We Didn't Start the Fire by Billy Joel? It's one of my favorite karaoke songs. I can sing that like nobody's business, okay? So I am not going to sing it. But there is a section of that bill where that pharmaceutical product makes it in. It goes Little Rock, Pasternak, Mickey Mantle, Kerouac, Sputnik, Chowan-Lai, Bridge on the River Kwai, Lebanon, Charles de Gaulle, California baseball, Starkweather homicide, children of the thalidomide. Well, maybe you don't know what thalidomide is. So I'll tell you quickly. Back in the day, about 60 years ago or so, it was a little pill that was prescribed to pregnant women who had morning sickness. Safe and effective, will treat your morning sickness. So mothers took that medication thinking it was safe for them to take and that would not harm their unborn child in the womb, right? Well, that little pill that was deemed harmless led to thousands of children being born with birth defects. In 1961, the manufacturer took it off the market. But it once was prescribed as safe and effective for pregnant women, that it was safe for their unborn child in the womb. And it turned out they were wrong. We don't have to agree on the vaccine issues. But we do have to give a platform to those who were injured by the vaccines. After my speech, I received numerous texts, one of which said, "Thank you, Rep. Franson, for your powerful testimony today in support of me and so many other struggling vaccine-injured Minnesotans who are being silenced, censored, and abandoned. I want to give you a Purple Heart for Team Humanity." Purple Heart is for those that have suffered serious adverse reactions. "You are forever in my gratitude. This is Susanna Newell, injured triathlete. This injured triathlete is now in a wheelchair. Her life forever affected." It's one of many of the text messages that I've received. These individuals need a voice at the table. Members, Big Pharma, I heard some member over there say, "Oh, if you want to stand up to Big Pharma, you got to vote yes for this bill." But when you had a chance to stand up to Big Pharma with the A12 amendment, you chose to stand up with a company that is held harmless, that is held absolutely harmless when it comes to vaccine injuries. As I stated, the first quarter of sales, Pfizer hit $26 billion. $26 billion. They reap all of the profit. Those that have the adverse reactions to the vaccines assume all of the liability. I think it's really disgusting. So I ask you, go straight to the pharmaceutical Pfizer data document dumps, because yesterday 90,702 pages was released. So this is going to continue on. But this is documents that Pfizer themselves wanted to keep hidden from the public for 75 years. Imagine if the Sackler family wanted to hide the opioid documents for 75 years. So I will be voting no on this bill. It's 876 pages of a hot mess. That's what it is, a hot mess. We can do better. Members, vote no.
I recognize the member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, you can tell that we're reaching the end here. I'm speaking on behalf of the early childhood portions of the bill. Wanted to especially address, I guess, maybe the first half of Representative Franson's comments relating to that portion of the bill and earlier comments as well to members. Members, we need to keep in mind that that we have a broken system when it comes to early care and learning. And I guess I want to make sure that we're all aware that the workforce shortages that we hear about in the rest of the bill, so when you're concerned about nursing homes and long-term care, when you're concerned about workforce shortages in the rest of our economy, that all ties back to this. So if your big concern is to make sure that we are addressing concerns in long-term care, that doesn't happen unless we address concerns in child care. And the fact is that as soon as a child turns 5, we suddenly spend 10 times as much money. If we did not have support for K-12, and I want to make sure we're clear, we're all thinking in the right way about this, regardless of what form of public support you believe K-12 education should have, once a child turns 5, there's that funding. If that wasn't in there, what would happen is that having your care and learning for your 8-year-old would be extremely expensive for your family. The people doing it would have poverty wages, and we would have real challenges. That's exactly what happens in those early years. So as I hear us trying to pick apart, I heard praise from Representative Dameth for early learning scholarships. Those are wonderful. We've put a lot of money in those in our bills, and in fact, more than the Republican Senate over a number of years. I hear criticism over the Child Care Assistance Program. That confuses me. That is a program that every one of our districts, every single one, is very dependent on so that parents can work, so that employers can expand, so that our communities can thrive. In fact, it is in the greater Minnesota districts that program is especially beneficial. And so we have got to continue to be supporting that program. Members, I've heard this concern about the integrity of that program. That is old news. In 2019, we passed a series of reforms to that program, and folks on our committee have been hearing about that. A series of things that then we got the report back on. to make sure that we have all kinds of reporting, to make sure that there's integrity in how that program is working. Members, this is now, I think, 4 years on that program has getting bashed, as your own constituents are benefiting hugely from that program. In fact, when I say constituents, I mean the employers in your district are benefiting from that. The long-term care workers, the people who are receiving poor wages in that area, well, the child care workers taking care of their kids are getting even worse wages. As I said earlier, a quarter of them experiencing food insecurity, a third of them on public assistance. Members, we have done a ton in that program that those who voted for HHS bills through the years have done that. And what it's left us in is we've got the integrity of the program except for one problem, which is the funding of the program. The rates in our state are in the bottom 5 in the country. And there's huge concerns then for making sure that there is support for families in the course of that program. So members, rather than pitting different approaches against one another, early learning scholarships and child care assistance and mixed delivery preschool, somehow we have a problem with preschool delivered in a wide variety of ways that then allows our kids to be connected with schools in their community and beyond. Rather than that, we need to recognize that we need an everything-in approach. We have a massive concern in this area. And finally, I just want to note, I think it was Representative Rasmussen who talked about the need to address the rising cost of living. This is a fundamental concern for our community, is the rising cost of childcare, not just for those families that are experiencing that right there, but in the ripple effects that it has throughout all of our communities and throughout all of our state. I want to make sure that we are clear that that this caucus, this chamber, all of us are supportive of our heroes in the family child care and our heroes in child care centers. And the idea of pitting folks against one another is getting extremely frustrating to me and I think to all members. Investments that come early have got the biggest payoff. And we know that getting kids off to a great start benefits all of us. It does so in the long run, but it benefits us right now so their parents can do what they need to do to support their families and have the dignity of work. I hear a lot about that. Let's make sure that we provide the support so they can do that, have that dignity themselves. Members, this is a terrific bill overall, and the parts that get kids off to a great start and support their families in early care and learning and beyond are an especially good part of this bill. Members, I would urge your support for the bill, and I'm honored to be standing up for it. Thank you, Mr. Speaker.
I recognize the member from Polk, Representative Keel.
Thank you, Mr. Speaker. Members, healthcare is a huge, huge bill, as we all know. And there are a lot of things to discuss, and we could talk about them all day long. I think we could go through the night if we wanted to go through every little detail again. But Representative Damas says not to bother, so I won't do that. No, she didn't really say that. But the issue that we talked about earlier, that I brought up in my amendment, nursing homes, it does not do what it needs to do for nursing homes. We have them just struggling to hire staff. We've talked about how we can fund that so that we make sure that there's opportunity for education. But members, at home, when I talk to, and I probably have said this before, I've talked to young ladies, students that have gone off to college, and they've come to me and they've said, you know, we talk about, hey, how are things going? How's your choice in education? And how are you liking nursing school? Well, I was required to take a vaccine, a COVID vaccine. Oh, yeah, what'd you decide to do about it? Well, I might have been in school for 2 years. One gal told me she was in school for 2 years. Another one was in 6 months. They all quit. They all walked away. They said, no, I'm not sure about vaccines. I'm very concerned about it. It is their personal choice. And so instead of going into nursing, which makes my heart sad because I think they would have been good nurses, they have chosen not to be there. And so while we talk about how we need to hire people, that is one of the discouragements that the federal government, President Biden, along with our Governor Walz, that they decided to do, that is going to create heartaches for us long down the road. You know, we were told that we really needed some permanent rate increases, some changes. Chair Schultz said 30 years ago we fixed this problem. Well, 30 years ago is a long time. It's a long time in education. It's a long time in healthcare. It just isn't, it needs to be addressed. Like I said before, there's a lot of changes in our healthcare and how we take care of people. You know, back when I was a nurse's aide on a surgical floor, I took care of people for at least a week when they came for a minor surgery. That now you come in, you go out, you're there for less than the day, you go home. And so there's just so many changes in how we look at it. Nursing homes are closing across the state. Members, remember, there's 16 that have closed in 19 and 4 that have closed just in 22 this year. It is sad to think of where those 95 residents in Ramsey County, we're not talking about a rural area, we're talking about a larger area. Where did those 95 people go? Did we send a family member an hour or so away, or did we keep them close to their family? Because I can tell you, family do much better when they have to go into a nursing home if they have grandchildren and children around to stop by, see how they're doing, what they need, how I can help, what can I do to make your life better. That's really important. You know, I think it's interesting that 3 years ago, we were talking about, the leadership at that point was talking about a $68 million cut to nursing homes. We're still not doing anything better. We're not helping nursing homes. We're not helping staff. Here we are. And then to make matters worse, this bill, which we haven't talked about, is creating an unelectable board with the power to create state rules telling homes how much they have to pay employees, while doing nothing to actually increase the reimbursements that would allow them to increase wages and benefits. I don't think anyone can argue that someone that works in a nursing home, whether they're providing food, dietary advice, cleaning, doing janitorial, billing services, nursing aides, RNs, but all of those things, how important they are and how they should be paid for their hard work. It isn't easy. It is very challenging. We have great tools in nursing homes now, but it still is a challenging job. We are dealing with people that are physically not able to do much, and in some cases, mentally not understanding who they are and where they, who their background is. And that takes a special person to take care of patients at that point, to understand what they need and how their health care needs to be taken care of. This board will not help seniors who need care. Nursing homes, I assume everybody knows this, but nursing homes are highly regulated. We have the federal regulations, so the Centers of Medicaid and Medicare Services, CMS, we have OSHA, they have state regulations by MDH and DHS, and I had a nursing home the other day call me and say MPCA was over because now they have to regulate and change some of their heating and their water systems. Now, do we want that to happen? Yes. But they said, well, we don't know where the money's coming from. We don't have it. Their housing is 70% less, or they're only up to 70% of their beds covered. So consequently, when you have that open bed situation, financially it gives an imbalance. You can think about education and how the classrooms went down and how schools are having financial troubles too. A newly unelected board would only add unnecessary layers to bureaucracy and redundancy. And I just am very disappointed that we're looking at that. The other subject I would like to briefly touch on is non-emergency medical transport, NEMT. My My husband tells me don't talk in alphabet soup, so I always try to spell out what it is, so we're talking about it. Non-emergency means that you don't have to have an ambulance come get you when you need to go someplace like dialysis or cancer treatment. Now, I know that we funded the PCAs to be able to drive people, but that doesn't mean if you don't have access to a wheelchair, a van, that a PCA could take that person. Only if the person themselves had that kind of transportation could they take them to a doctor's appointment at a grocery store or whatever they needed to do. But an NEMT takes people to all these appointments, and not everyone needs, not everyone has a PCA to take them. Members, we funded in the bill with the ambulance services, there is an inflator for fuel, but it isn't only their fuel that increased. As we all see the fuel prices, we know that that must have cost them quite a bit. But their insurance has gone up tremendously. They drive long ways. If anyone has ever been to Roseau, Minnesota, you know how far away that is. It is easily an 8-hour drive from here. My NEMT services drives from Roseau to Grand Forks, which is at least a 2.5, 3-hour drive. Fargo, should somebody need treatment, those are the places they're going to go. Bemidji, they are going to drive those distances to get somebody to a treatment because we don't have dialysis in every hospital in every area. So those things are taken. Of course, some of the cancer treatments are closer, but most of them are not. Once again, they are 3-4 hours away. These businesses are struggling. And we're not talking about northwestern Minnesota only. We're talking about all of Minnesota, including the metropolitan area. There are businesses telling me they aren't going to survive. They can't afford to keep going, and we did nothing for them. We have done nothing for them in the last 3 years. We should have changed the rate. We could have helped them out. And furthermore, I know that the Democrats are interested in helping everybody in all the other ethnic avenues. We got to make sure we take care of everyone. Well, that business is being hurt also. There's a gentleman, I don't know what his nationality is, but he's trying to run a business and helping people that can't physically get, cannot ride the different opportunities that are in the cities, and he can't get the help he needs to be able to transport people. Whether it's in a wheelchair or a ride to a facility, they need to have help with that. And you cannot ride the buses or light rail or whatever when you have some of the health issues that you have. So this is an important service that we did not help at all. We heard the bill earlier, I believe last year. And we had many people talk about how important this was, but not addressed. So with that, I'm saddened to say I will not be supporting a bill I served quite a bit of time on, and both health and human services. But this is just not where we should be. So I hope with some discussion on the other body that we come back with something much better, although I don't have a lot of confidence. Thank you, members.
I recognize the member from Rock, Representative Schumacher.
Thank you, Mr. Speaker and members, for the opportunity to discuss this bill today. And to begin with, members, I would just like to thank the nonpartisan staff that we got to work with over the last 2 years on these bills that have come forward. And just listing them off: Randy Chung, Elizabeth Clarkvest, Danielle Pinelli, Sarah Sunderman, Annie Mock, Doug Berg, and Joe Harway, all very useful, very talented, very necessary in order for this work to get done. And so we're just thankful for that. And members, as we look at this bill and whether we vote for this 860 some odd page bill or not, that we have to take a few things into consideration. And the thing that comes to mind for me with this bill is when you have a hammer, everything looks like a nail. And when you try to solve problems with a hammer, you don't get the best results all the time. And When you work in the legislature and you have problems arise, you think that the government is the best solution for every issue that comes up, and that's not always the case. And after we've spent the last 2 years with government being more involved in our healthcare decisions as Minnesotans, more than any other time in our history, we have a bill in front of us that involves the government in our healthcare even more. This bill gives the government more say in your health insurance. It's pulling more people into public programs as well as studying single payer. Even after a Minnesota Department of Health 2020 Consumer Experience Report shows on page 9 of the report that the consumers who are using the managed care organizations versus the consumers who are using the Minnesota Care, the people who are using managed care were actually happier. They were more satisfied with the type of health care they were getting and just overall health care that they were getting, the types of service, the types of health care that they were receiving. People in managed care were happier with that than those who were in Minnesota Care. So if you're not happy with the insurance and you're part of the government, you use your hammer and you bring more people into the Minnesota Care program that people don't even like as much. This bill gets the government more involved with those who are trying to operate hospitals and build teams with their new boards. And the same thing can be said for nursing homes. But when, again, another 2020 study from the Minnesota Department of Health, when they looked at the registered nurse workforce, 95% of nurses were overall or very satisfied with the job that they have. Of course, these numbers were pre-pandemic, but you can't blame what's happened over the last 2 years to our nursing staff in the hospital systems towards hospital greed when they're working on 1% to 3% margins, and we had a pandemic to deal with. These are nationwide issues that we have to deal with, and we should be dealing with them from a nationwide standpoint, which is why many of us support efforts that will actually contribute to the skills and to the desires of nurses to be able to practice at the level that they so choose. And that's why we support things like the Enhanced Nurse Licensure Compact, which involves more nurses, more states, so that they can practice and they can be held with the same level of respect that all of the surrounding nurses and all the surrounding states get to enjoy. But that's more of a private sector solution to finding satisfaction for nurses, and so we can't find that in the bills that we have moving forward today. My favorite piece in this is how government knows best, as we heard from Representative Rasmussen before, and it's when we require something of private sector but then exclude the government from having those same things. And we see that with the pieces that we have in here on the frozen formulary for pharmaceuticals. And we require it for the private sector because we're the government and we have the hammer, but we won't use it on ourselves because it costs money, which means it's going to raise the cost of health care for those who are in the private sector with that. And we have to deal with that moving forward, except for in the government, because we know what's better for you than what we have to set up for ourselves. We also see government being able to set the prices of prescription drugs in this bill, because having any kind of free market say in our prescription drug prices would be just absurd. This bill also holds some insured premium taxes to 3.5%. This tax, like the sick tax we discussed earlier, is the one thing in government that contributes to and benefits from higher rates in the cost of health care. And so really disappointing that we're seeing that, again, government being able to grow there. So again, members, 2 years of more government involvement in our healthcare decisions than we've seen in our history. And this bill is a doubling down on those ideas when we have alternatives that are readily available. And we're seeing this doubling down in areas that Minnesotans really don't even want. And so, members, today I would ask you to please vote no.
I recognize the member from Scott, Representative Albright.
Thank you, Mr. Speaker. Members, wow, this is maybe shorter than I thought some of us thought this debate was going to go today. So we're getting getting out of here early. Brevity is not my friend today, Mr. Speaker. First, I want to recognize some folks that have expended a great deal of time and effort. They've been noted before, but Chair Liebling, Chair Schultz, Chair Pinto, Chair Fisher, Chair Gomez. You have led your respective committees and you put forth your parts in this bill in a way that you have felt exemplifies the best efforts from your perspective. You know, it used to be when I was in the investment advisory field and I would talk about health care, and you talk about that health care basically is about providing a pill, a part, or a place. And we've talked about all of those today. If you present yourself and you've got a malady that requires a pill, they prescribe it. If you're walking around a little hobbled and you need a new knee or a hip or a digit on your finger, they'll put a new part in you. The problem that we face now, and it's really a function of demographics more than anything, and that's what this body struggles with regularly, is the place. And that place can take on a lot of different iterations. Whether you're retired, whether you're convalescing, whether you're in need of care that requires intensive services. And it's not just for the elderly. It can be for those that are in substance abuse. It can be for those that are younger and are needing care because of their disabilities or because of their health. That place comes to each one of us, whether for ourselves personally or for our family members. It's an excruciating decision-making process. And sometimes you have to make it more than once. This bill tries to address it, but as I've said in other committees, it's amorphous. You can't put it in a box, you can't put it up on the wall and say you're done. It is an ongoing dilemma that this chamber and this legislature will struggle with. You know, as I said in Ways and Means here a couple days ago, this bill is not perfect. Nor do I think that it recognizes the balance that our constituents are looking for. But let me just address a few of the things that I would find positive about the bill. You do include, and there are included in this bill, investments for workforce, including incentive grants for home and community-based workers. Kudos. You're expanding the availability for health professionals for loan forgiveness, notably those who wish to practice in rural settings. You're emphasizing an increase on PCA rates. We've had a long conversation about those today. I hope that that continues as we move into conference. You also talk about consumer-directed community support budgets. Talk about elderly waiver rates. And as has been said, we also have in the provisions in the bill efforts towards NEMT and ambulance service rates. You would think with a bill that is of 875 pages, and granted, when you change one word, you have to include the whole section, it gets quite lengthy. But I think it was said earlier today, there are 161 bills in this omnibus bill. But that being said, there are some provisions in this bill that give me and many others on this side of the aisle, and I dare say some on your side as well, give us pause. You're going to require hospitals to implement nurse staffing ratios. When the nurses and in coordination with their administration know best how to place people. Moving forward on the implementation of a single payer system. You've got a task force in there. Make no mistake, that is the inception of where we do not believe the state should go with health care for people in the state. You're creating a managed care opt-out. That basically means that you're moving even more MA enrollees to a fee-for-service approach. You go so far as to eliminate some effective use of cost sharing for health plans. That's a reform that has worked. I'm curious to know why you would remove it. You're creating a drug affordability board. Your price setting. That's excluding the private sector entirely. If you want to allow prices to rise up at that cap, have at it, but that's exactly what you're going to do. You're going to set the top end of what those drugs will cost and remove all competitiveness from the people that are providing them to compete for that market share by reducing their cost. You go so far as to prohibiting white bagging. That's a practice used by insurers to control the costs of expensive clinician-administered drugs. Again, why? Why in a time when we talk about the cost of health care as growing and growing and growing, are you taking tools off the table for the private sector, for the patient, and for the clinicians to deliver health care that's effective and reduces the cost? That being said, you also want to create a healthcare affordability board. It's been talked about before. With fines up to $500,000 on providers that go over their spending targets. So government isn't going to say what you can spend. And then if you don't, you go over. I heard once said, oh, well, you just need to tell us why. And with that explanation, just send a check. Nursing home workforce standards. Come on, folks. At a very time when these folks are in dire need of assistance, you're telling them that you have to provide even more stringent standards and regulatory enforcement on them. You're growing welfare programs and CCAP benefits, but you're reducing the checks on eligibility. We talked about fraud. Why would you do that? Fiscally, total new appropriations of $2.8 billion. $32 million in fiscal year 22. $735 million in fiscal 23. $920 million in fiscal year 24. $1,100 million in fiscal year 25. Then you also add 1,200 new FTEs to the agencies that will support these initiatives. It kind of makes you start to wonder if this bill is intentional about patient independence or cunning in its desire to drive consumer dependence on government programs. It's been said, but I think it's important to note the lack of recognition about the crisis in our DWRS system. And I know it's been said, but I will only make one further point. Since the fall of 2021, over 74 group homes have closed around this state. 10 in Olmsted County alone. And these closures are not specifically due to the pandemic. I would dare say they were a result of chronic shortages in staffing. That's only been intensified by the pandemic, and now we've hit a tipping point. And dare I say, we better move fast. Otherwise, there is no return. We've lost 33 on average over the prior 4 quarters. Where do these people go? What are their families to do? We speak about balance in the work that we do here. We talk about wants compared to needs, and I've heard it articulated very, very well throughout the course of the debate today. We talk about investments in consideration of reforms. I'm also reminded, and I've said this a lot, but I'll say it again. Healthcare, by and large, focuses on 3 different groups of constituents. Those that are in the dawn of life, those that are in the twilight of life, and as we've heard today, those that are in the shadows of life. If there's one charge that this bill should make as its priority, it should be to those that are in the shadows of life. If you can say that this bill achieves that, then vote for it. I can't. Members, the growth of spending in this bill outpaces a number of factors. It is unsustainable. When you grow faster than the rate of inflation, when spending grows faster than the state tax revenues that are coming into our state, when you have population growth that is lagging behind the pace at which you're increasing expenditures within the Health and Human Services budget, and when you are antagonistic to the very private sector that funds these programs through their tax receipts to the state, again, it is unsustainable. Members, I've been on Health and Human Services for a number of years, and I have served in a number of capacities, but the one graph that I am reminded of on a regular basis is the hierarchy of needs. And the dedication that we have as legislators to take care of those that should be our priority, to lift them up and to make them see their best days for themselves. Not because of a government program, but because of their decision to make every day their best day. Members, I cannot say that this bill accomplishes that I would urge a red vote. And thank you for the time today. Thank you, Mr. Speaker.
I recognize the author of the bill, the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. And I know everyone waits for this moment because it means the debate is almost over. And it has been a long debate, although not as long as some. But I have been listening very carefully to what members have said, and I do want to just make a few remarks in closing, because I do want to just hit a few points. I'm obviously not going to try to rebut or answer every single thing that was said, because we'd be here many more hours, and I know that nobody wants to do that. But what I do here, first of all, just to respond a little bit to the last comments we heard about outpacing inflation and so on. In this bill, the target, at least for human services and health together, is a 2.4% increase over the base. This is not outpacing inflation. Granted, healthcare usually rises faster than the cost of inflation. So if that is the intent of the comment, then that would, of course, be valid, because we do know that healthcare tends to increase very, very quickly. What I've heard from a lot of the Republican members is kind of a dilemma that you have. On the one hand, you want to spend more money. You want to spend. You hear the stories and you want to respond. And you want to respond by spending state money. And on the other hand, you say, don't spend. We shouldn't spend. We shouldn't spend any state money. Well, there are things that we do need to spend money on. There are crises that are happening. But at the same time, I think we have to recognize that money doesn't solve all of the problems. And right now, we have a tremendous workforce shortage that money will only do so much to solve. Now, not to say we shouldn't try, but money will not solve all of our problems. I just want to really make clear, there's been a lot of discussion today, and I think Representative Schultz answered very, very well about all of the great things in this bill to help people with disabilities. And there are many. It is really a great bill for people with disabilities. And if you care about that, you should definitely vote for this bill. But not everything has to be in our bill to be happening. And I was struck by Representative Schumacher's comment that if all you have is a hammer, everything's a nail. If all you have is a bill and you're thinking that the bill is everything, then you're going to be disappointed, because we can't address everything and do everything every single year. But we have services that we fund, and they are the very ones that the Republican members are complaining are not in the bill, because they are already funded. And we did this. And in fact, as Chair Schultz said, the Republicans voted against it, but we did fund these services. Now, are we saying that solves every problem and they don't have a problem? No, of course, we're not saying that. But there are other areas of service that are not getting automatic increases, that do not get inflationary increases. So nursing homes get cost-based funding. They report their costs and they get reimbursed for that funding. So their spending and their reimbursement does go up over time. The same is true in the disability waiver rate system. And Chair Schultz went through that very effectively. So just because it's not in this bill does not mean that no extra money is being spent. We are spending a lot of money. And one of the members talked about how our budgets have gone up, and they have. And a lot of it is because of this spending that we are doing. So unfortunately, we're not solving every problem, but we certainly care, and we're certainly trying. It's very easy to say no. No is just very easy. And I know it's easy when you have an omnibus bill. You can always find something you don't like, and you can always find something to be against. It is much harder to find solutions to the concerns of our state, to the multiple crises happening in our state. And this bill really tries to do that, as we said at the outset. I just want to bring you back. It wasn't that long ago under President Trump, when Republicans had all three branches of the federal government. They were in the majority, and everybody was hating on the Affordable Care Act and wanted to repeal it and replace it. Well, they failed to repeal it by one vote. If you all remember, Senator John McCain voted no on the repeal, but there was never a plan to replace. No solutions, no solutions. The solutions are so much harder to come by. The big Republican solution that we've seen is reinsurance, which of course is not in this bill. It already passed. It's already been funded for 3 more years at the cost of over $800 million. And a lot of that, of course, is coming from the Healthcare Access Fund. And it is competing. It is, make no mistake about it, it is competing with other needs in healthcare. And that money, I would argue and have argued for many years, is going to insurance companies and is really not working as hard for Minnesotans as it should be. I do want to talk a little bit about COVID because there's been a lot of discussion that I do want to respond to. Several members have talked about the long COVID program that is in the bill. And I think it's been cast in a very unfair light and needs to be responded to. So first of all, I hope everybody realizes that COVID is not the flu. COVID has turned out to be an extremely serious problem. Almost 1 million Americans have died of COVID-19. So this is very, very serious. But the people who've survived, and it's a lot of people have survived COVID, thankfully, but a huge number of them are getting this thing called long COVID. There isn't a really good name, and long COVID has very serious symptoms, and they vary a lot for different people. And we heard a couple of presentations about this in our committee. And no one should downplay this, because this is, for those who are suffering from this can be debilitating and very long term. And this, again, is going to impact our society, our workforce, parents. You don't have to be old and have comorbidities to have long COVID. It's a very serious matter. And so in this bill, there's an attempt by the Department of Health to begin getting our arms around this as a state. And just to begin figuring out what's going on with this so that we can begin to address it, because it is a very serious public health issue. And I hope I'm wrong, but I think it's going to become a more serious public health issue as time goes on. And so this has been really demonized in this bill, but if you read the actual language of the provision, there is nothing in here that's talking about taking anybody's data, having any change. It doesn't change any law around taking or using any data. Anything that is already, whatever protections are in current law, already is operating under this small provision that's in the bill that simply has the Commissioner of Health establishing a program to begin to figure out what's going on. And there was a sort of a suggestion made by a kind of a partial reading of the language of the provision that sort of suggested that somehow they're going to be sharing everybody's data with all these groups and so on. And that's a complete misreading of what's going on in the bill, because they are being told to consult with all kinds of different entities, including community organizations, and to identify priority actions and activities, to address needs for communication, services, resources, tools, etc. So this is not sharing anybody's data. This is doing exactly what they should do, which is talk to everybody involved, the people, we use that horrible word, stakeholders. We use that a lot in the legislature. But this is talking to people about what should happen to start to figure out how we deal with this really serious emerging public health matter. So I want to just mention a couple of more things that have been said before I close here. And Representative Schumacher was talking about managed care versus Minnesota Care and expanding Minnesota Care. I want to make clear that Minnesota Care, our program, Minnesota Care, is run through managed care. So maybe I misunderstood, but those are the same thing. Absolutely the same thing. And talking about trying to have free market solutions for drug prices. You know, if we had a free market for drugs, that might hold some water. But I think pretty much everybody understands that there's a rigged market for drugs. And when you start having hearings, as we did, and trying to understand, you know, who's doing what and who's taking the profits and why are the expenses so high, even for a drug like insulin, which has been around for so long and is so cheap to produce, and yet people are just being gouged on their insulin that they need to survive. So why is all this happening? Well, everybody points to everybody else. But the reality is, the one thing that is very clear is the lobbyists sure come out, the high paid lobbyists for the drug companies sure come out and tell you to stop doing things like this white bagging bill that's been mentioned, which is very much requested by the providers. And I have to say, I believe this is a patient safety issue, that when someone needs an injectable administered drug that to be administered by their physician, that they shouldn't have to go through some other pharmacy. And we heard some pretty bad stories about this. So I think this is an important thing. And just because the drug company and the PBM lobbyists don't like it does not tell me that we shouldn't do it. So there are a lot of other things that could be discussed here. But I think that this bill does a lot. We tried to listen to Minnesotans. It's not a perfect bill. None of them are. And, you know, we're going to, I hope, pass this bill today and work some things out with the Senate and try to make it a better bill, because there are some things that still could use a little more work and, you know, a little amending and need some more discussion. And we're going to do that in the conference process. But this is a very good bill. This bill tries to lower prices for Minnesotans. And I think it does a good job, because we cannot leave Minnesotans at the mercy of the drug companies. That's for sure. So we got to try something. And if you want to try nothing, this is not the bill for you. We're going to try, and we're going to try to bring down prices for healthcare. And we have in this bill removing some of the cost barriers for people who in fact are insured, have insurance, but they can't use it because of the costs that they have to pay out of pocket. We need to address these things, and this bill tries to do it. So if you want to do nothing, if you want to don't try anything, then vote no. But this is a bill that tries. We look at different solutions, and we're pushing forward because these are serious issues, and Minnesotans expect us to stand up to the big interests and to do what we need to do in their best interests. And so that's what we are doing in this bill. So members, thank you so much for your attention today. And I urge you to vote yes on this very, very good bill. Thank you.
There being no further discussion, the clerk will take the roll on the bill.
Members, please vote.
Yep, I got it right here.
Will the clerk please call the names of the members who've not yet voted?
Bolden.
Bolden, aye.
Bolden, aye. Frazier.
Frazier, aye.
Frazier, aye. Garofalo.
Garofalo, no.
Garofalo, no. Hamilton.
Hamilton, no.
Hamilton, no. Hausman.
Hausman, aye.
Hausman, aye. Moran.
Moran, aye.
Moran, aye. Pearson.
Pearson, no.
Pearson, no. Swazinski. Swazinski. Thompson.
Swazinski, no.
Swazinski, no.
Swazinski, no.
Thompson. Thompson.
Votes aye.
Thompson, aye. Zhang Jie.
Zhang Jie, aye.
Zhang Jie, aye.
The clerk will close the roll. There being 69 ayes and 64 nays, the bill is passed as amended and its title agreed to.